Ciao, buongiorno.
Buongiorno, buon pomeriggio, ciao Giorgio.
Ciao Nicola.
Buon pomeriggio, benvenute e benvenuti a questo appuntamento annuale della Behavioral Insights Unit del laboratorio Management e Sanità della Scuola Sant'Anna. Io sono Nicola Bellè e come molti di voi sanno coordino un gruppo di ricercatrici e di ricercatori che si occupano dell'applicazione delle scienze comportamentali al miglioramento organizzativo. Qua vedete il programma della giornata che passeremo insieme e che sarà dedicata allo studio del fattore umano a supporto del management pubblico. Come avete visto nel programma, la prima mezz'ora dell'incontro si terrà in italiano e in questa sessione racconteremo, sintetizzeremo parte delle attività che le ricercatrici e ricercatori della Behavioral Insights Unit del Sant'Anna hanno svolto nel corso dell'ultimo anno. Alle ore 15 inizierà una sessione in lingua inglese nella quale interverranno gli ospiti che vedete qui elencati, che poi presenterò più nel dettaglio. Alle ore 17 avremo una sessione conclusiva nella quale ci scambieremo opinioni e suggestioni anche per le future attività. Coloro che stanno seguendo dal canale YouTube possono porre domande, indicare commenti nella chat e noi ci incaricheremo poi di girare domande e commenti alle relatrici e ai relatori. Inizio con una breve sintesi delle attività che il gruppo di ricerca della Behavioral Insights Unit ha svolto nel corso di questo ultimo anno. Come sapete, questa unità è stata creata per supportare le aziende, le professioniste, i professionisti del servizio sanitario della regione Toscana e delle altre regioni che appartengono al network MES. Questi sono gli appuntamenti degli ultimi anni dal momento della creazione dell'unità, quindi abbiamo un appuntamento fisso nel mese di dicembre che si rinnova quest'anno. Nel corso dell'anno abbiamo poi degli eventi tematici che per il 2023 vedete qui riportati. Ad ottobre abbiamo ospitato un evento internazionale dedicato alle direzioni future di quella che si chiama pubblica amministrazione comportamentale e un evento collegato dedicato alle possibilità delle euristiche applicate ai processi organizzativi. A fine novembre abbiamo ospitato un workshop internazionale dedicato all'applicazione delle scienze comportamentali alla progettazione delle cartelle cliniche elettroniche come esempio di architettura delle scelte. Questi sono i volti di alcune delle persone che in questi anni ci hanno onorato del loro tempo, della loro collaborazione, del loro scambio e del loro contributo intellettuale e vedremo alcune di queste persone anche nella sessione successiva in lingua inglese. Il centro della nostra attenzione è il fattore umano. Sappiamo che ciascuna organizzazione deve perseguire la propria missione. Per farlo dipende dalla qualità delle decisioni, dalla motivazione delle professioniste e dei professionisti che ogni giorno col loro lavoro sono chiamati a realizzare strategie, piani, procedure e programmi. Prestiamo molta attenzione alla fase di elaborazione di queste strategie, di questi piani, la cosiddetta fase di pianificazione. Prestiamo molta attenzione alla misurazione dei risultati. Spesso ci dimentichiamo, prestiamo un'attenzione minore alla fase di esecuzione, di implementazione. Questo è problematico perché spesso strategie e piani che funzionano alla perfezione sulla carta, nella realtà si inceppano, non producono i risultati attesi e le scienze comportamentali, che chiamano questo fenomeno gap di implementazione, ci dimostrano che per ridurlo è necessario mettere al centro il fattore umano e questo è ciò che facciamo. Ci occupiamo di decisioni, ci occupiamo di motivazione delle professioniste e dei professionisti per informare e migliorare l'architettura delle scelte e l'organizzazione. Per quanto riguarda il primo di questi tasselli, farò adesso un approfondimento su quello, si avvale, come peraltro gli altri, di uno strumento di raccolta di dati preziosissimi che vengono raccolti attraverso delle indagini alle professioniste e ai professionisti, indagini costruite secondo i crismi stabiliti a livello internazionale per questo tipo di strumenti. Dal momento della creazione della Behavioural Insights Unit abbiamo effettuato 13 indagini in 10 istituzioni, raccogliendo complessivamente più di 152.000 risposte complete di professioniste e professionisti, quindi questo è un patrimonio immenso. Qua vedete una rappresentazione grafica delle 13 indagini svolte dal 2018 con i tassi di partecipazione in ciascuna di queste indagini. Per quanto concerne l'anno che si sta chiudendo, il 2023, abbiamo effettuato 3 indagini in ordine temporale, la prima all'interno del sistema sociosanitario regionale del Veneto, successivamente all'interno del servizio sanitario toscano e infine all'interno dell'azienda sanitaria dell'Alto Adige. Nel corso del 2023 abbiamo raccolto più di 59.000 risposte complete da professioniste e professionisti di questi sistemi. Studiamo le decisioni perché, come ci ricorda il premio Nobel Herbert Simon, i processi decisionali sono il cuore della gestione e non possiamo che partire da lì. Nell'ambito di questo binario della nostra attività abbiamo completato e pubblicato una revisione sistematica sull'uso delle informazioni in ambito pubblico e questa revisione ci ha consentito di sviluppare un framework che vedete qui rappresentato, che ci dice come l'uso delle informazioni sia influenzato e dipenda dall'architettura di queste informazioni e come questa relazione tra architettura e uso sia diversa, eterogenea a seconda delle tipologie di utilizzatori, cittadini, dipendenti pubblici, manager pubblici, dipendenti pubblici che lavorano in comparti diversi. Nel corso dell'anno abbiamo pubblicato uno studio che illustra i risultati di 7 test sperimentali randomizzati che hanno coinvolto più di 14.000 professioniste e professionisti con profilo amministrativo e tecnico delle aziende sanitarie pubbliche. E questo studio contribuisce all'avanzamento di quella che si chiama economia aziendale comportamentale. Il filone di studi sulla scienza delle decisioni compie circa mezzo secolo. Uno dei fenomeni ampiamente studiati è quello dei bias, che abbiamo discusso anche lo scorso anno, ossia di anomalie decisionali che confliggono con l'ideale di un decisore perfettamente razionale in grado di ottimizzare e dotato di autocontrollo. Queste anomalie, che in parte hanno delle caratteristiche di prevedibilità, si configurano come reazioni eccessive e reattività eccessiva a elementi del contesto decisionale apparentemente irrilevanti, ad esempio il framing positivo oppure negativo dello stesso dato. Per un paziente, ma anche per un professionista, il 10% di rischio di morte e il 90% di probabilità di sopravvivenza, sebbene oggettivamente equivalenti, non sono la stessa cosa. Ecco, vi illustro alcuni degli studi che abbiamo condotto nell'ambito dell'investigazione dei bias. Questo è uno studio condotto con 588 professioniste e professionisti di un'agenzia regionale di protezione ambientale, ai quali abbiamo chiesto di medesimarsi in questo scenario. Immagini che la sua regione si trovi a fronteggiare un'emergenza ambientale che rischia di distruggere 6.000 ettari di coltivazioni. Sono stati proposti 2 piani alternativi per affrontare l'emergenza. Ipotizzi che le stime esatte delle conseguenze dei 2 piani siano quelle indicate di seguito. Quale dei 2 piani suggerisce di adottare? Una prima metà dei partecipanti si è trovata di fronte 2 opzioni. Se il piano A viene adottato, 2.000 ettari saranno salvati. L'altra opzione, se il piano B viene adottato, c'è 1/3 di probabilità che 6.000 ettari saranno salvati e 2/3 di probabilità che nessun ettaro sarà salvato. Come potete notare, un'opzione è una certezza, l'altra opzione è probabilistica, anche se il valore atteso è il medesimo, 2.000. In altre parole, questa metà di partecipanti è stata chiamata a scegliere tra un'opzione certa e un'opzione probabile con lo stesso valore atteso. Notate il linguaggio, parliamo di ettari salvati, quindi abbiamo un framing positivo. Ecco, di fronte a un'opzione certa e una probabilistica, con un framing positivo, l'84% delle persone partecipanti sceglie l'opzione certa. L'altra metà delle persone che hanno partecipato si è trovata lo stesso problema, lo stesso dilemma, espresso però con un framing negativo. invece di parlare di 2000 ettari salvati, parliamo di 4000 ettari distrutti, ma la logica è esattamente la stessa. Bene, sebbene le quantità siano le medesime, l'unica cosa che cambia è il framing, vedete che in questo caso l'opzione probabilistica diventa più appetibile dell'opzione certa, ossia della perdita certa. Ecco, questo è un esempio di effetto framing. Nello stesso contesto abbiamo chiesto di medesimarsi in quest'altro scenario. 2 aree agricole sono minacciate dalla stessa emergenza fitosanitaria. Quale dei seguenti interventi suggerirebbe di adottare? Sulla sinistra vedete la prima opzione, trattamento completo nell'area più piccola dove gli ettari che saranno distrutti si riducono da 4.000 a 0 e trattamento parziale nell'area più grande dove gli ettari che saranno distrutti si riducono da 8.000 a 7.000. Oppure l'altra opzione, trattamento parziale in entrambe le aree, nell'area più piccola gli ettari distrutti si riducono da 4.000 a 2.000. Nell'area più grande gli ettari distrutti si riducono da 8.000 a 4.000. Facendo due conti, nell'opzione a sinistra si riescono a risparmiare 5.000 ettari, nell'opzione a destra si riescono a risparmiare 6.000 ettari, quindi l'opzione a destra è razionalmente più conveniente. Nonostante questo, ben il 29%, qua ci aspetteremmo uno zero, sceglie l'opzione inferiore. Perché? Perché siamo attirati dalla possibilità di azzerare il rischio di ridurlo completamente in una delle due aree, sebbene il risultato finale, l'outcome, non sia quello più vantaggioso. Lo scorso anno abbiamo parlato della difficoltà di utilizzare anche tra gli esperti le probabilità per prendere delle decisioni. Questo è uno scenario presentato a dei medici, un soggetto su 1000 affetto dalla malattia X. Il tasso di falsi positivi è del 5%. Qual è la probabilità che un soggetto con un test positivo sia malato? Qua vedete c'è una concentrazione di risposte al 95%. Moltissimi rispondono al 95%. La probabilità reale è di poco inferiore al 2% in realtà, molto distante dalla risposta. Perché? Perché il problema è espresso in termini di probabilità. Se esprimiamo e illustriamo un problema non equivalente ma analogo, parlando però di frequenze invece che di probabilità, test positivo per 50 soggetti su 1000, anche se solo uno su 1000 è affetto dalla malattia, vedete che la stima del numero di soggetti malati tra i positivi si avvicina molto a quella corretta. Molti indicano il valore corretto di 1. Ancora una volta, il framing dell'informazione in termini di probabilità o di frequenze cambia molto la qualità delle decisioni. L'altro fenomeno che studiamo è quello dell'eterogeneità, del cosiddetto noise. Qua vedete che la probabilità di prescrivere un farmaco è più alta, guardate la barra in mezzo, se il prescrittore sa che l'efficacia è del 90% ed è più basso se il prescrittore sa che la non efficacia è del 10%. Queste due quantità ovviamente sono equivalenti, l'effetto framing fa spostare la decisione. Beh, non solo bias, ma anche noise. Vedete quanta variabilità c'è tra chi è presentato e chi vede l'informazione con un framing positivo e l'informazione con un framing negativo. Questa è un'attività di ricerca sulla quale investiremo nei prossimi mesi e anni, lo studio del noise, della variabilità, perché decisori diversi prendono decisioni così diverse e sono sensibili a fattori apparentemente irrilevanti del contesto decisionale, ma in modo diverso. Ecco, una suggestione ci viene da questa immagine. È un'anatra o un coniglio? Alcuni di voi che si focalizzano sul becco la vedranno all'inizio come un'anatra. Alcuni che si focalizzano sull'occhio la vedranno come un coniglio. Il tema di ricerca è sui meccanismi sorgente di questi fenomeni. Ce ne sono due in particolare che sono molto promettenti. Sono l'attenzione selettiva e la memoria selettiva. Quando prendiamo decisioni o formuliamo giudizi, tendiamo ad utilizzare di più in modo sproporzionato gli elementi che ci saltano agli occhi o che ci vengono in mente.
La seconda tessera del puzzle della Behavioural Insights Unit indaga le dinamiche motivazionali. In questo ambito abbiamo proseguito gli studi relativi all'impatto degli stili di reciprocità sulla soddisfazione lavorativa. Ebbene, Adam Grant sostiene che gli individui affrontano le interazioni con colleghe e colleghi attraverso gli stili di reciprocità. I giver cercano di capire cosa possono fare per gli altri, mostrando anche capacità di autoprotezione per evitare stress patologico e burnout. Al contrario, i taker si concentrano su cosa gli altri possono fare per loro, mentre i matcher cercano un equilibrio tra dare e ricevere. Ebbene, in uno studio randomizzato con circa 3.300 professioniste e professionisti della sanità, avere un superiore che sia un giver aumenta la soddisfazione delle dipendenti e dei dipendenti rispetto ad avere un superiore che sia un matcher oppure un taker. E questo anche controllando per molteplici stili di direzione, inclusa la leadership di servizio, ossia lo stile direzionale che vede il superiore mettersi a servizio dei membri del gruppo, dando priorità assoluta al soddisfacimento dei loro bisogni. L'impatto di avere un superiore che sia un giver permane anche quando controlliamo per gli stili di comunicazione. Interessantissimo riflettere anche sul fatto che nel contesto sanitario in cui abbiamo svolto lo studio, quando misuriamo lo stile di reciprocità delle colleghe e dei colleghi, oltre a quella della superiore o del superiore, avere un responsabile che sia un giver aumenta la motivazione lavorativa anche se in misura minore rispetto ad avere dei pari grado che siano dei giver. Ecco, questi risultati hanno implicazioni gestionali molto rilevanti per l'organizzazione dei gruppi di lavoro. Un'altra prospettiva dalla quale possiamo studiare le dinamiche motivazionali è quella delle tipologie di beneficiari delle decisioni che professioniste e professionisti prendono. In quest'ottica i benefici di un comportamento possono essere di tipo individuale oppure possono essere a favore e a vantaggio di familiari e amici e naturalmente a favore dei pazienti. Ecco, in uno studio randomizzato con circa 13.700 operatrici ed operatori sanitari, l'intenzione di vaccinarsi contro l'influenza stagionale è maggiore quando incoraggiamo professioniste e professionisti a riflettere sull'impatto positivo che questo può avere sulla loro famiglia e sui loro amici oppure sui loro pazienti. Al contrario, lo stimolo di riflettere sui benefici personali non ha un impatto significativo sull'intenzione di vaccinarsi. Ritroviamo risultati analoghi anche quando misuriamo la propensione di operatrici ed operatori ad incoraggiare colleghe e colleghi a vaccinarsi contro l'influenza. Questo grafico ci dà un'informazione aggiuntiva, ci chiarisce che queste evidenze variano in base alla famiglia professionale. In altre parole, è un monito fortissimo che non esistono strumenti motivazionali standardizzati che vanno bene sempre e per tutti nel momento in cui vogliamo incoraggiare un comportamento desiderato. Il terzo tassello del puzzle di attività della Behavioural Insights Unit indaga l'architettura delle scelte sulla base di rigorose evidenze che suggeriscono come gli architetti delle scelte abbiano il compito, nonché la responsabilità di organizzare il contesto nel quale operatori ed operatrici prendono le decisioni. Sapendo che non esiste una architettura neutrale. Con una metafora che già avevamo evidenziato lo scorso anno, un'architettura delle scelte piuttosto che un'altra può generare una navigazione sicura oppure una navigazione anche molto molto pericolosa. Ecco, un ambito che certamente si qualifica come architettura delle scelte è il disegno delle competenze manageriali per coloro che all'interno dei sistemi sanitari hanno incarichi di responsabilità di struttura o incarichi di gestione di gruppi di lavoro, affinché ovviamente queste competenze possano garantire elevati livelli di performance, tanto a livello individuale quanto a livello organizzativo. In un ampio campione di circa 25.000 dipendenti della sanità abbiamo testato il framework di competenze manageriali disegnato e utilizzato dalla Commissione europea per i propri dirigenti. Ecco, tra le 5 competenze manageriali che vedete qui, quelle relazionali hanno il peso maggiore nel garantire elevati livelli di performance della struttura. E vedete che la gestione delle persone insieme alle competenze relazionali contano per il 50%. Un altro ambito che quotidianamente incide sull'architettura delle scelte è il costo delle procedure burocratiche. Ecco, per la prima volta a livello internazionale abbiamo misurato le percezioni di questi costi legati alle procedure burocratiche tra i dipendenti. Vedete un campione di circa 26.500 persone. Ecco, notiamo come i dirigenti medici siano coloro che hanno una percezione superiore relativa ai costi delle procedure burocratiche, per quanto nessuna delle famiglie professionali sia davvero esente dal percepire questi costi. Non solo, ma in uno studio randomizzato con circa 21.000 esperti ci siamo chiesti quale tipologia di costo danneggi maggiormente la performance lavorativa. Ecco, emerge come siano i costi psicologici legati alla riduzione di autonomia e legati allo stress lavorativo generato, quelli che incidono maggiormente sulla riduzione della performance, più dei costi di apprendimento legati alla difficoltà e alla complessità delle procedure burocratiche e ai costi di conformità alle stesse procedure. Inoltre, sempre in tema di noise, che continueremo a studiare nei prossimi anni in termini di eterogeneità, questi costi, il costo delle procedure burocratiche, ha un impatto diverso se segmentiamo la popolazione per alcune variabili di interesse. Se guardiamo all'età, per esempio, vediamo come gli under 50 in contrapposizione agli over 50 siano maggiormente in difficoltà e in sofferenza. I profili non clinici, soprattutto per quanto riguarda i costi psicologici, sono maggiormente in sofferenza rispetto ai profili clinici. In generale, il costo delle procedure burocratiche riduce la performance in misura maggiore tra i professionisti di genere maschile rispetto alle professioniste di genere femminile. Sempre in tema di costo delle procedure burocratiche, ma spostando il focus dalla performance all'adozione di una innovazione organizzativa, abbiamo studiato come le procedure burocratiche impattino sulle preferenze, controllando per queste altre dimensioni, quindi dinamiche relazionali, sforzo, evidenze scientifiche e linee guida e costo dell'innovazione stessa. Ecco, in questo studio, con un campione di circa 3.300 professioniste e professionisti, emerge che procedure burocratiche più semplici agevolano il cambiamento al pari di un basso costo dell'innovazione organizzativa, hanno un impatto superiore a quello dello sforzo individuale e inferiore a quello delle dinamiche relazionali e a quello che suggeriscono evidenze scientifiche e linee guida. Anche in questo caso, in questo studio con circa 580 dipendenti di un'agenzia regionale di protezione dell'ambiente, notiamo che gli adempimenti burocratici sono un fattore fattore determinante sia per il rispetto che per la violazione di una norma di protezione ambientale. Ecco, ricollegandoci all'impatto delle trappole decisionali, vediamo che l'importanza relativa delle procedure burocratiche rispetto agli altri fattori varia al variare del framing positivo oppure negativo del contesto decisionale. Un'ultima pista di lavoro all'interno del tassello di puzzle relativo all'architettura delle scelte è senz'altro il telework o il tema del lavoro agile, che in questi anni ovviamente è diventato un tema importantissimo. In questa review della letteratura, in questa sintesi della letteratura che alcuni miei colleghi hanno condotto, vediamo come temi legati al telework che sono stati studiati nella letteratura fanno per esempio riferimento alle percezioni sulla produttività individuale, sul bilanciamento vita e lavoro, sull'intenzione di cambiare lavoro e sulla soddisfazione lavorativa. Ecco, sarà interessantissimo nei prossimi mesi, nei prossimi anni proseguire in questa direzione, quindi capire e approfondire se ed in che modo il telelavoro ha un effetto diverso per famiglie professionali diverse.
I'm sorry, what?
Hi Pam. Concludo segnalandovi che all'interno delle indagini di clima organizzativo c'è un item relativo alle percezioni di sostenibilità dei ritmi di lavoro e possiamo cercare di capire se queste percezioni variano oppure no al variare dell'introduzione dell'uso di sistemi di lavoro agile. Grazie, passiamo alla sessione internazionale.
Allora, grazie a tutti. Termina qui la sessione in italiano. We'll switch now to English. So I welcome some of the speakers that are already seeing the screen. So this session is titled International Perspectives on Behavioral Public Administration. And the first speakers will be Pamela Hurd and Donald Mohinian. So Dr. Hurd is professor at the McCart School of Public Policy at Georgetown University. And hi, Don. And her research focuses on inequality and how it intersects with health, aging, policymaking. She's also a global expert in survey research. And Dr. Hurd also does research on administrative burden, which is the bureaucratic obstacles that citizens, but also workers face when they're trying to access information, benefits, services, and rights. So Pam is especially interested in how this burden both is shaped by and also reinforces inequality. And together with Donald Mohinian, let's say hi to him as well. They also have a book titled Administrative Burden, Policymaking by Other Means, which they introduced last year during last year's meeting. The other speaker is Dr. Mohinian. He's the inaugural McCourt chair at the McCourt School of Public Policy at Georgetown University, and his research aims at improving how government works. He's a great expert of administrative burdens as well. And he studies this topic with the goal of making public organization better. At the McCourt School, he co-directs, as a matter of fact, a Better Government Lab. And he's also the current president, if I'm not mistaken, of the Association of Public Policy and Management. So Pam and Don, so thank you very much for your time and your presence here today. The floor is yours. You have about 40 minutes for your presentation and for taking some questions.
Great, thanks so much for having us. I'm gonna share our screen here. There we go. Okay. So it's not letting me share our screen.
Is the PowerPoint open?
Yeah, it's right there. So. Oh, thank you very much. Okay, now I should be able to.
Working now, okay.
Yeah, fair enough. There's always a bit of a glitch. Let's try again. Yeah, I'm not sure why it is not letting me. I wonder, can you... You've allowed permission to... So you did make me a co-host, but it is still not allowing me to share. Let me try the entire screen. Nope. Yeah, I'm not sure why. It's just not allowed. It's saying it can't display the shared content because I don't have permissions. Maybe we can email you the slides. Would that be okay? And we can just have you guys scroll through them.
Yeah. So
Yes, great.
I just sent you the slides, Nico, so you should be able to see those. So while we're getting set up, I'll just introduce our topic. And for those of you who were here last year, some of this might be a little bit redundant, but some reminders I think would be helpful as well. So we'll talk a little bit about what the concept of administrative burden is. And some of the things that have changed in the last couple of years is that we see more attention to this concept in government in the United States. And so we'll talk more about a policy infrastructure that has emerged in the last couple of years at the federal level and is starting to become more prominent at state level as well. We'll also talk about some specific examples of research that we've undertaken to reduce administrative burden, working with a combination of civic tech organizations and state governments. Thanks. And you can move ahead to the outline. And we'll conclude by drawing on a recent report that we issued to the US federal government about how to identify and reduce administrative burdens. But basically, the key questions that are motivating us and will guide our presentation is: what are administrative burdens? Why do they matter? And what can we do about them? With more attention to the third question of what to do about them. So I'll start with the first question of what are administrative burdens. Next slide, please. And we're motivated here by a desire to have a language and a framework to think about problems that we all encounter as citizens or as government employees working within government. Everyone has a story about red tape or delay or frustration with some sort of government service, but we don't always necessarily conceptualize that in our analysis or our research or our policy reforms. And so the research here is an attempt to partly provide a framework to think about these sorts of problems and then engage in research or action to reduce those problems. Next slide. And the normative assumptions that are driving our work is that we would want government, in most cases, to be experienced as simple, accessible, and respectful. When we encounter with government, that would be our expectations. And so we want to pay attention to people's experiences and see if they match up to these fairly simple standards. Next slide. So next I'll just remind folks what are administrative burdens. And we think of them as the sort of frictions that people experience when they encounter public services. And they can be big and they can be small, but we think of 3 different types of buckets that make up administrative burdens. The first is learning costs. So simply finding out about some sort of public service, or if you're eligible for it, or what you have to do to engage with it. This is not information that we're born with. It requires some efforts on our part to figure that out. The second category is compliance costs. And this is more of the traditional red tape we might experience in government. So filling out forms, the time you spend waiting for processes, if you have to pull together documentation, if you have to go to some sort of bureaucratic meeting, if you have to spend money on a lawyer or an advocate, we think of those as falling into the category of compliance costs. But we also experience government in an emotional fashion. And so some of our compliance costs or learning costs might cause us to become frustrated, or we might have some sense of loss of autonomy or control in our interactions with government, or we might have some sense of fear. So we think about these range of emotional responses as well as the psychological costs that arise when people engage with government. Next slide. Underneath some of our studies here are a couple of assumptions that I think there is fairly good evidence for at this point. Sometimes burdens that look fairly innocuous and reasonable when designed by a public official can have these very large effects on citizens when they actually encounter government. So small burdens can have big effects. Second, that these effects are not always distributed evenly across the population. We have some evidence that people with less resources struggle more with burdens. And less resources can mean financial resources. It could also mean educational resources, your social networks that you draw on to provide help when you interact with government, or also things like mental health and physical health. So in some recent work, we've provided evidence that people with lower mental health and physical health struggle more with administrative processes. And ultimately, we think that these experiences matter because they shape how we think about our relationship with government. So from a democratic perspective, if we think of a social contract occurring, we want that contract to be such that both sides are filling their end of the bargain. And this is one way to measure whether that's happening or not. Next slide, please. So I'm going to talk quickly about some of the things that have changed in the United States over the last couple of years that cumulatively generate a new policy infrastructure around reduction of administrative burdens. So this is going to be more US specific, but I think will give a sense of things policymakers can do if they want to draw attention to this as a topic. Next slide. In December of 2021, President Biden signed an executive order transforming the federal customer experience and service delivery to rebuild trust in government is the full title. And within that executive order, there was specific mention of reducing administrative burdens. Next slide. In particular, President Biden identified a series of specific services and agencies that have the most interaction with the public. These are called high-impact service providers, and they have to identify each year particular administrative burdens that they will promise to reduce. So there's a sort of performance reporting element to this. In addition to this action, there is new guidance from something called the Paperwork Reduction Act, which is a piece of legislation that's long been in place, which is intended to do what it sounds like, which is reduce paperwork burdens on the public, but was never really implemented terribly well. It didn't have much teeth to it. And so the current administration has basically interpreted this more broadly as a means to reduce administrative burdens. So there's language in this updated guidance that says agencies have to measure learning costs, compliance costs, and psychological costs that people experience when they interact with government. And so this is a government-wide mandate for all agencies, where now agencies have to report back on what they're doing to reduce administrative burdens. You also see similar mandates in agencies' existing performance reporting structures. Next slide, please. So cumulatively, what does this mean? I think if you study public sector reform, it's always easy to be a little bit cynical about new initiatives, whether they're going to take hold or not. And I think it's reasonable to assume that there will be some differences in outcomes from one agency to another, and Pam will talk about maybe some of the reasons for that in a little bit. But at a basic level, this change in policy has given a permission structure for agency leaders or people working within agencies who do care about the experiences of the public to do something about it. So they're able to waive the executive order or the updated guidance and say, the president says this is important, we need to measure these things, we need to do something about it. It also gives a license to people outside of government, so advocates or people who are clients or representing those clients, to say, you're supposed to be fixing particular problems. Why aren't you dealing with this particular problem? And in the US system, they have multiple opportunities to weigh in and make comments on specific administrative actions that federal agencies take. And so again, this is a very sort of American story of what's happening, but I think it's possible to think about what would the infrastructure look like in Italy or in specific regions within Italy if you're thinking about how to adopt some of these ideas. Next slide. So ultimately, I think there are some guidelines here you could think of at the very broadest level without thinking about specific policy actions. One is that when governments are engaged in some sort of action, whether it's designing a public policy or something as simple as deciding how people are going to wait in the waiting room, they should think about the burdens that exist. And in some cases, burdens are very much justified and they serve legitimate purposes. And so we don't argue against that. But what we want policymakers and practitioners to do is think about the costs as well as the benefits of burdens, and ask whether sometimes those costs exceed the benefits. We also think if you're going to study this topic, it makes sense, given what we know about the unequal effect of burdens, that you would think about the potential negative effects on some groups more than others. Cass Sunstein has written about this topic as well. So he is the author of Nudge, and so he called his version of the topic sludge. So it rhymes well, but he uses the term sludge audits as a nice way to think about some sort of process that a government puts in place to measure, identify, and reduce burdens, with the idea that, like with other types of audits, this should be happening on a routine basis as part of a normal structure of government operations. The next thing we'll talk about is the practical solutions that governments can undertake to actually reduce burdens.
All right, next slide, please. Yeah, so we're going to talk a little bit about some specific examples, sort of categories of interventions, and then specific examples of those interventions in particular cases. So broadly speaking, this is sort of one way to think about this toolbox is we're moving from sort of narrow to more expansive approaches, and probably in terms of their impact, smaller to larger impact interventions. So the first sort of obvious intervention are informational nudges, right? Like these are cheap, easy, and popular. You just slightly reframe things, or you send a letter, or you give people a piece of information, and then that can change people's behavior. What we generically know about informational nudges is they work best when the primary intervention or primary problem, primary burden are learning costs. When the process maybe is just confusing and a piece of information will address kind of all of the costs. Informational nudges tend to be somewhat less successful when you have high levels of compliance costs or high levels of psychological costs. So the next sort of category you can think of are process simplifications. So reducing, the length of a form, for example, or reducing the amount of documentation people need to provide. Then we shift more towards interventions, help. You don't change the process. You effectively don't change the burdens and the process. You just give someone assistance to navigate that complicated process. And then the fourth category is effectively you shift the burdens back onto the state. And here are especially really automated processes, which effectively don't require the citizen or beneficiary to really do anything to access a service or benefit. Like all of those sort of processes and costs are kind of put on the state. Next slide, please. So we're going to talk about 3 different examples. As well, there's actually a fourth one. There is a quick one at the end. But we're going to use 3 different examples of work that we have been doing over the past couple of years with Code for America. So in the US, there's these sort of civic tech nonprofits who have cropped up increasingly. And their mission basically is to improve government processes in varying ways, uses of technology. And when I say uses of technology, this doesn't mean just sort of changing a website. They mean this in kind of a much broader sense. And hopefully you'll get examples of that breadth in the examples that we give. But the partnership that we have with Code for America is based on a large grant that they received to provide assistance to states in the US to improve access to social welfare benefit programs in different states. So we're going to talk about a few of those projects and different tools that have worked in the context of that Code for America collaboration. Next slide, please. So we're going to start a little bit narrow and talk about an intervention that was effectively an informational nudge. It was a way to improve information. So broadly speaking, sometimes people can really struggle to understand the language that they're given when they're trying to enroll in a program or stay in a program. So it's sort of bureaucratic language, right? That makes sense to bureaucrats, but maybe doesn't make sense to beneficiaries. And the example in the US was around a program that helps people buy food. Basically, it's a food support program. It's for low-income households. And part of the process of eligibility is documenting your income, which can be complicated and confusing, especially if you don't have a more standard form of employment. For example, if you drive for Uber, sort of that self-employment income can pose some challenges in the process of documenting eligibility for the program. So in California, if you declare that you are self-employed, it actually makes that process easier. They sort of automate part of the process if you say you're self-employed. And so you are more likely to become eligible basically just because it simplifies the process. Unfortunately, the way that they ask whether or not you're self-employed, though, is super confusing. So what Code for America did was implement an experiment where they altered the language basically to make it clearer to an individual that they are in fact self-employed and that they should basically check that box. And so basically what they were seeing in the process was that, well, 17% of the process was self-employed. Next slide, please. they were getting far fewer numbers of people actually identifying that. So this just gives you a sense of what the intervention looked like in terms of the treatment, in terms of how they clarified the language. I hope you guys can see that. It's looking a little small on my slide. Next slide, please. So the result was, in fact, that this really increased the percentage of people who did, in fact, identify as self-employed throughout this process of obtaining eligibility for the program. So in the status quo explanation, how they had been asking people, it was 8.8 percentage points, and that jumped to almost just over 12 percentage points in terms of people identifying as self-employed. And again, this was an RCT, and there's equivalents across categories and stuff. So that's an example of a nudge. We need to make sure that people understand during eligibility processes what's being asked of them, and what category basically they should fit into with language that makes sense to them. Next slide, please. This is now a bit more of a complicated process where we're trying to basically address both learning costs, but actually also compliance costs as well. So in a lot of programs, particularly in the US, you're required to do an interview. And this tends to be a really big explanation for why people fail to complete processes of enrollment, is they don't end up doing the interview. And there's a range of different reasons. It can be that they forget about the interview. It can be that they have no control over when that interview happens. So they're told you have to be, in this office on Monday at 2 p.m. that someone's working. So we know this is a huge problem. In the state that we did this intervention in, Colorado, the intervention was focused again on a nutritional assistance program. So it basically gives money to people to buy food, low-income populations. And in this program in Colorado, about half of people who were denied eligibility for the program, about half of them were denied that eligibility simply because they didn't complete the interview. So it was a huge problem. So the intervention was a two-parter. Basically, it was a text reminder, because we know sometimes people forget about it, but it also gave people flexibility to schedule the interview themselves. So that rather than being like told a time and feeling like you just had to do that time or you weren't going to be able to do the interview, they allowed people's scheduling flexibility to do that. And it had a big impact. Basically, we ended up with a 7 percentage point increase, both in the completion of the interviews and then as well as the actual approval rate in the program. Next slide, please. So that's a sort of medium intervention, right? Like it's both an informational nudge, but also addressing some of those compliance costs. The next intervention we're going to talk about is the kind of as close as you're going to get to a magic bullet to address burdens, which are automated processes, right? So this is the variation where we shift a lot of the burden back on to the state to manage these processes to prove eligibility. So the example that we're using here was in the state of Minnesota, and it's the Medicaid program. So the Medicaid program in the US is health insurance for low-income populations. And one of the things about the Medicaid program and being on it is that every year you need to prove that you're still eligible. So once you get on it, you basically have to keep proving that you can stay on it. And one of the things that happened in the pandemic, though, and we know actually that this process of needing to prove you're still eligible, a lot of people lose coverage due to the burdens. So in the US, we call this churn. But generically, you see high fractions of people who end up getting kicked off the program at that renewal phase, even though they're still eligible. During the pandemic, however, one of the provisions was that they were not allowed to kick people off the program. So people did not have to keep renewing on an annual basis. They could just stay on the program, basically. This led to huge increases in enrollment in the program. But then when the pandemic emergency ended, when the public health emergency ended, states over the past year have started to be required to recertify folks, to basically all of those folks on Medicaid. So everyone on the Medicaid program had to show that they were indeed still eligible. So this is a huge task for states. One of the ways to do this is something called, well, in the US parlance, it's ex parte renewals. But basically what it means is there is a version of that renewal process that rather than requiring beneficiaries to collect all the paperwork and sign forms and do all of that, the state can take information it already has about that individual and just automate the process, do it behind the scenes, and determine whether or not individuals are still eligible. And this is increasingly a tool that states have, but not all states are doing. So in Minnesota, Code for America worked with the state of Minnesota to do these automated renewals in the this was just in July, so this is sort of the end of the public health emergency, and to do automated renewals on a subset of the population in the Medicaid program, which are the aged, blind, and disabled. And the result basically has been pretty impressive. So stepping back writ large, not just in Minnesota, one of the things that we saw happening as states were starting to go through these processes of reevaluating whether or not people were still eligible, is that large fractions of people were getting kicked off the program for procedural reasons. So in some states, as many as like over 60% of people who were going through these processes were getting kicked off, not because they weren't eligible, but because of a procedural problem. So this was Code for America's attempt to help Minnesota navigate this process in a way to reduce burdens for individuals in that program. Next slide. So here's what happened. In July, they rolled out these renewal processes in Minnesota. Okay, so we're looking at July and August, the difference between what happened in July and August. The populations in July and August were not very different, the Medicaid populations. They weren't different, actually, really. The only thing that was different between July and August was whether or not Minnesota instituted these ex parte renewals for this population. Basically, they automated renewals. So in the population for which they did not automate renewals, only 40% were actually determined eligible and stayed on the program. In the next month, when they did automated renewals, 80%. So there was a huge difference, basically, in terms of who actually was able to stay on the program. Now, I just want to make a few clarifying points. First of all, a lot of the people in July who were not enrolled, it's probably just a delay. So maybe in 6-7 months, they will end up back on the program. So this does not mean that they're permanently kicked off the program. So it just may have meant a long delay and lack of coverage for a period of time. So that's the first thing to understand. The second thing to understand is these are really extreme circumstances where states got inundated with just large numbers of renewals that they had to process. So this is one way to think about this difference between 40% and 80%, is that this is under very extreme conditions, how an automated renewal process can actually help states effectively manage that process. So if we did this 2 years from now, the difference might not be as extreme, basically, is the point. All right, go ahead. Next slide, please. This is just a difference by different groups in terms of the impact this had. So the bottom rung is the July group. The top, the dark blue, is the August group. And what you see is generically across different segments of the population, this had similar impacts, basically going through the automated renewal versus the standard paper renewal. The one big difference actually was a race difference, which was that it closed the race gap, basically, in terms of who was getting renewed. So we're still in the data analysis part of this project. So there's still a lot we need to do, but these are some of the preliminary findings. And this is, I think, the point here that we're just trying to make, is that these automated renewal processes can just have very, very large impacts. Next slide, please. The last example we're going to quickly talk about here is really in the context of the US federal government, and another example of how automated processes can have very large impacts. So what happened here basically is that, the US is unique in the extent to which individuals end up with a lot of student loan debt, right? Now, there was this provision basically that for individuals who are disabled, they could have their loans forgiven, actually. So all of the student debt that they accrued, if you can prove you're disabled, you can have that debt dismissed. In practice, however, this was not happening, that there were large fractions of people eligible for this who were not having their loans dismissed. And a big part of the hang up was basically whether or not, or proving that you were disabled and that you were disabled. So the Department of Education worked very closely with the Social Security Administration to help kind of ease this process, and ultimately to do a kind of automated renewal process, or sorry, not renewal, an automated process to eliminate people's debt. Next slide, please. The next slide, please. There you go. Thank you. So basically what they did, sorry, back one. All that they did basically was work this collaboration between these two different federal agencies that typically in the US are not allowed to talk to each other. This is sort of part of a broader burden reduction strategy that Don was talking about at the beginning in terms of changes that the US federal government is starting to make to reduce burden. So these are agencies that are not typically allowed to exchange information with each other or talk to each other. But they managed to work out a way to do it. And the gist is Social Security, which can determine whether or not people are eligible, people end up receiving benefits, were determined eligible by the Social Security Administration. That's transferred or shared with the Department of Education, who determined effectively we can relieve debt for a certain set of individuals, and they just automatically discharge debt for hundreds of thousands of individuals. Next slide, please. Okay, now I'm going to wrap up here quickly with different kinds of organizational and cultural factors that can underlie the effectiveness of whether agencies can actually implement these kinds of processes or these examples that we talked about in the last section. Next slide, please. One of the first critical parts, broadly speaking, is actually agency culture. So this was based on a range of different interviews that we did with federal agencies in the US in terms of their response to the executive orders that Don detailed earlier in the slides. So a key factor in this agency culture is whether or not leadership makes this central. Do they put the public at the center? Do they put at the center making interactions with their agencies simple, accessible, and respectful? A second key component to this is how they tie that to the mission of their own agency, right? So it isn't just sort of generically, let's have these interactions be good. It's about connecting it with whatever the particular mission of that agency is. And thirdly, that it embeds processes of change. So rather than thinking about eligibility processes, for example, as just sort of stagnant, we design them, they're done, we're constantly updating them to make those processes easier for people to navigate. Second, having low walls and avoiding silos. So basically, a lot of the agencies that we're talking about here are huge, right? The Social Security Administration is managing programs that cover 40% of the US population at any given moment. Huge agencies. But they need to be able to interact across agency, different components of the agency to effectively improve these processes for individuals. So you need the lawyers who deal with privacy issues of sharing information, talking to the people who are actually designing the forms. Across the agency, we need people talking to each other. Next slide, please. One really great example here is the Veterans Administration in the US. So the VA is kind of well known increasingly actually at being especially good at improving their interaction with the population that they serve in the US, which is veterans. And the gist is this happened as a function of a scandal that happened about 15 years ago, where they were effectively having tons of problems. They got caught up in a big scandal. And agency leadership just decided to act and really started to implement a lot of the principles that I just talked about. So you can kind of read this here, but this gives an example of how this particular agency effectively linked these principles to their own agency missions, how they built it into their agency mission, in fact. And then they came up with these 3 principles, right? Ease, effectiveness, and emotion. And these are principles that for example, when we were doing interviews with folks in this agency, that they would come back to when they were talking about different processes or different examples of changes that they had made within the agency about how they interact with veterans in the US. Next slide, please. Broadly speaking, it is critical though, right? Like, it's not just about culture. These agencies really do need to have capacity. So in the US context, at least, one thing that we learned was pretty central, which was having, we call them CX teams here, but they're just basically like an entity within the organization whose sole mission is to focus on customer experience, is to focus on the experience of the public that's interacting with that agency. And that team needs to have sufficient authority and resources to kind of connect different parts of the agency to this broader goal and engaging them in different processes to actually enact those changes across the agency. And really also at a fundamental level, and as researchers, I think a lot of us can understand this, like, you actually have to measure these things too. And so we spent a lot of time in agencies talking about different ways that folks think about measurement, and we as well have engaged in research on our own about how to do this well. So I think I'm going to stop here. And we're happy to kind of take questions if folks have, or I'm sorry, I shouldn't have jumped to that. We'll stop here and then we'll let you guys guide the process from there forward.
Thank you so much, Pam and Don. Hi, Elizabeth. I saw you popping up. I think that we don't really have much time for questions, but picking up on some of the comments, I would like to ask you to quickly elaborate and expand on the measurement part. You mentioned, so I think this also here, it is a kind of a high interest. How can we measure? So you mentioned the sludge audits. I mean, I think if I'm not mistaken, Kastenstein, during a talk last year, he mentioned the fact that an estimation says that the federal government in the US is taxing citizens with 11.6 billion hours of sludge. So how can we measure administrative burdens, and both on citizens and maybe also on public workers? That's the...
So I'll start broad and then Don will follow up with a couple of specifics. But I think broadly speaking, I think most important is to step back and think about measuring it both in what we might think of as subjective ways and objective ways. So, right, like the time thing, how much time does people spend is really objective. Like, we can measure the amount of time people spend on an application. We can measure the fraction of people who take up benefits who are eligible for them, right? So you have those very, very precise measurements. That's good. The other way to think about it, complementary, I think an additional way that's important, are subjective measures. How do people actually feel about these processes? What's their assessment of how burdensome they are? And that's important in part because the objective measures, I think, risk sometimes being misleading. So for example, if you redesign a form so that it takes people 27 minutes instead of 29 minutes to complete, and then I add that up across 1 million beneficiaries, well, that seems like a huge thing. And it is. but the individuals themselves may not actually experience it that way. So especially once we start connecting these things to people's perceptions of government, their trust in government, all of those sorts of things, you do also want to take into account these subjective measures as well. And I think Don has some.
Yeah, so I think measurement is important partly because it makes visible the impact of burdens in a way that was less visible before. But we use measures for different purposes. Sometimes we use measures at a very high level to communicate. So CASA's example of 11 billion hours stays in our brain. It's a very memorable measure. Or the Veterans Administration has a measure of trust in their services that they talk about all the time. So those are really good high-level indicators of an emotional response in the case of the VA, or an objective measure. But those measures themselves don't tell you how to improve or get to those outcomes. So you need a different set of measures that help you to understand how are we doing when it comes to reducing the time tax on people, or what is it that makes people more or less trusting of government. And that, includes doing things like A/B testing of different approaches, measuring the impact of that on things like people's responses or smaller objective outcomes. So this is also like the classic challenge with any performance management technique, is you want high-level indicators that you can communicate to policymakers and the public, and then you want more micro indicators that can help people working within the agencies actually improve what they're doing on a day-to-day basis. So there isn't a single measure, you need all of them. We've been spending time on developing survey items that agencies can attach to surveys of users to help them understand if the experience is more or less burdensome. But there isn't going to be a single one best way of doing it.
Thank you so much, Pam and Don. I really want to express my gratitude for your time and perceptive insights on this huge topic, huge for us as well in Italy. So thank you so much. So I'll now yield the floor to Elizabeth. I see her there. So thank you, Elizabeth, for joining us. So Dr. Linas is the Emma Bloomberg Associate Professor for Public Policy and Management. And she's also the Faculty Director of the People Lab at Harvard Kennedy School of Government. Most of her research focuses on how to improve government by focusing on its people and on the services that they deliver. She uses insights from behavioral science and evidence from public management to consider how to recruit, retain, and support the government workforce, how to reduce administrative burdens that in particular low-income households face when they interact with government. And she's also an expert in experimental public administration, I would say. So I yield the floor to Elizabeth. Let's try if it works, the sharing thing. And Elizabeth, you have like some 20 minutes, including Q&As, if you want to leave some time. Yeah.
That sounds great. And thank you so much for the invitation. I'm calling in from Montgomery, Alabama, where my team is having a retreat. So I apologize for the bizarre presentation, but I was thrilled to be a part of this, and just hearing Don and Pam speak about their work. It's always great to get this community back together. So thank you for organizing. Okay, I'm going to try my best here to share some slides. I'm not sure if you can.
Yes, it does. It does work.
Perfect. That was by accident. I can't see you anymore, but as long as you can see the full slides,
it's fine.
It should be okay.
It's fine. I think it's the settings. So we see you while like speaking, and we see the slides perfectly. So
great. So last time, I guess last year, I gave an overview of kind of the People Lab and the type of research we do. This time I thought I would focus in on a recent paper that we just published that we're excited about, but I'm very happy to take questions on our broader research agenda as well. So this is a collaboration with a lot of co-authors, as you can see, Jessica Lasky-Fink, Chris Larkin, Lindsay Moore, and Elspeth Kirkman. And basically starts with the observation that oftentimes we talk about government-resident interactions, and we want to improve government-resident interactions. But a lot of that really depends on things that are happening in writing. So government effectiveness, we know, requires better interactions, but oftentimes those are happening through letters, at least in the US, or postcards, or the written word. And what's interesting is that we have a lot of evidence where written communication is the way in which we try to affect key outcomes, like who accesses public funds or benefits, like Don and Pam's work, citizen co-production of services, even who wins elections. And at the same time, we're grappling with very low trust in government and competing demands for attention. So this is kind of a background in which we're thinking about this specific project. And for this audience, hopefully I don't need to say a lot, but we do have a huge literature that thinks about what language to use to address many of the kind of biases that we have as residents. So to address inattention, inertia, complexity, increased take-up. And as we were looking through all this literature, we realized there's a lot less evidence in our field, in the kind of behavioral public administration field, on how to format those written communications. So we spend a lot of time on the words, but much less time on the design and the formatting of those communications, even though all of us who do experimental work are making decisions all the time about how to design a letter or a postcard or a mailer, the formatting of that. And rather than kind of testing that more actively, we really rely on these other literatures from other fields. One on conversational human voice, which is a long literature that suggests that being essentially more informal or more conversational or more human in your tone is going to improve trust and engagement. And then also literature from graphic design that talks about what can literally catch people's attention. So research on visuals and colors and contrast, where the outcome is not whether or not you actually change your behavior, but whether or not your eyes move in a specific direction and something is more salient. It turns out those kind of literatures have been very, very influential in our beliefs. So this is just a prediction study where we asked experts both from government and from academia, so the two audiences that are designing these government communications, what they thought would be more effective on design and formatting. And I don't know if you can see my my mouse, but essentially what you see is throughout both academia and government, yes, we overwhelmingly, we overwhelmingly see most people think colorful mailers are going to be much more effective. More informal language, 72% think are going to be more effective. Low reading level and more images are going to be good. So even though we haven't tested these, we have very strong priors as a community about what would be effective. Now, it turns out that we're wrong on 3 or 4 of those, which I'll share in a second. And so the big research question we're asking here is, if you're going to be doing a lot of government outreach and you're going to be doing written communication, how does the formality of that communication affect engagement and take-up? The main kind of big picture findings that I want to share is, one, formality is a construct that is distinguishable from, say, complexity, which we'll talk about, and we show that it's movable. As I mentioned, practitioners and scholars alike are predicting that more informal communication will increase engagement and take-up. Turns out they're wrong. We're wrong. I was also wrong. And it turns out that formality might actually be an effective heuristic for credibility and importance when it comes to government communication. So what do I mean by formality? We're going to define formality along 2 axes, both linguistic and aesthetic. So in terms of language, formal language we define as a high reading level, more complex writing, passive tone in English, more impersonal writing. And then on aesthetics, we think of more formal writing as kind of black and white, standard Times New Roman font, no images, no graphics. And the converse is more informal. So colors, novelty fonts, images, graphics, all these things that we've all assumed would be good for increasing take-up or engagement, we would consider informal. So just to give you an example of what this looks like in practice, here are two letters that have the same language, but are essentially, one is much more informal and one is more formal. You can see the choice of color and stamps and little images at the bottom. The one on the right looks more like a traditional government formal communication, but essentially they are very similar in terms of their underlying call to action. You'll also see some changes in terms of the informality of the language. So, dear neighbor, I inspected your property, as opposed to as authorized by, blah, 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 Metro Court of Ordinance, your property was inspected. So changing the passive to active voice. And what we find just in this first study, where we go online to look at how people perceive these two letters, we see kind of what we expect, that if you try to ask people on a scale of 1 to 10 that we've then standardized, how formal are these two different letters, people can really recognize the difference in formality. So a formal aesthetic seems to be very important or distinguishable. Informal language is also distinguishable, but when you put the two together, the sum of their parts is larger. So the formality that people associate with this letter on the right is much higher than the informal letter. So as a starting point, people recognize it, and importantly, it is not the same as just complex language. Even just changing the aesthetics, so just the colors, the images, whether or not you have other colors or stamps, that's going to cause more or less formality, even if the language itself is identical. So with that in mind, we go to the field and we document whether or not more formal language is going to be more effective or less effective at increasing engagement in 3 different policy domains. These are all real government communications that went out where we tested formality between 2017 and 2019. So about 85,000 people were involved, and we supplemented that with the prediction study that I shared with you. I don't have time to go through each study individually, but just to give you a sense of what the treatments are, this is a study that was done to increase the take-up of the Earned Income Tax Credit, which is a tax-based benefit in the US, sent out by the state of California. On the left, you'll see a more formal letter. On the right, you'll see the informal letter. One thing I should note is that the state agency preferred the letter on the right, the informal one. That's what the communications department designed, and I think it's pretty clear that they are different in terms of images. What you'll note is that the language is identical. So here we're just changing aesthetics. Here's a different experiment that we did with a city government that was trying to increase take-up of essentially an insurance, health insurance service that they had for ambulance services. Again, we have a much more formal version and an informal version at the city level. And this is for a different city. This is for registration of businesses. So this city, like many cities in the US, we're trying to encourage minority-owned and women-owned businesses to register as minority-owned and women-owned businesses for the city. And we're sending out mailers to business owners. Again, we have a very informal version and a formal version. Now, for those who have been doing kind of behavioral science research for a while or have been, running these interventions, all of these are kind of classic changes that we and I have made to many letters in government. But it turns out that across these 3 very different contexts, different levels of government, different calls to action, in each case, the formal letter does better than the informal letter. And on the right here, just to give you a sense of what I'm showing you the percentage of experts who predicted that correctly for each of these letters. So when we showed people the individual letters before showing them the results, only 10% of people thought the formal letter would do better, 15% for the local government service, and again, about 11% for the earned income tax credit. So these are cases where the vast majority of experts thought that it would be better to do a more informal letter, and all the evidence suggests that we were all wrong. So the question is why? We went back to online studies to really try to understand the causal mechanisms here, and we ran 2 studies. One varied the request. So we've made some informal and formal letters. And in this version, we just asked people without showing them the letters. Imagine you got a letter that involved signing up for an alert or attending an event or paying a fine. So very different behavioral outcomes. And then we also varied the source. Imagine it comes from a nonprofit or a private company or the government. And we ask questions about how important it is to take action, how likely you are to face consequences if you don't take action, and how formal do you expect the communication to be before you see it. We run another study where we show them each of the field experiment letters that I just showed you, the 6 letters that I just showed you, and we ask people to rank or measure perceived formality, comprehension. Did they understand what the letter was asking them to do? Whether or not they thought it was sent from the government, perception of the source, and a bunch of different measures that I'll show you, perception of the message itself, as well as ease of taking action and the likelihood of taking action. So one thing you'll notice, we're both trying to measure what's happening in terms of people's expectations and comprehension, but ultimately we're trying to get at the behavioral shift. Like, are you actually going to do something with this letter when it appears in your mailbox? And what we see across both of these studies is that regardless of the ask, it doesn't matter if it's paying a fine or coming to an event, people expect the government communication to be more formal. They think it's more important to respond to it. And they are more likely to think that there's going to be consequences if they don't respond. So we have a sense, at least in the US right now, that when the government sends you a letter, you have to respond. And so anything that signals, we think, that this is coming from the government are things that people are going to take more seriously. When we showed people the different letters, formal and informal, people thought the more formal letter came from a more credible source, so more competent, more trustworthy, more genuine, so very strong dimensions of trust. They thought the message was more important, less likely to be a scam, more relevant to them, and they report more likely to say that they would act. So we have 2 things happening here at once that are really based on expectations about government, but also a sense of trust and credibility that comes with formality, at least in the US context right now. And also, my sense is expectations about what scams look like and what kind of people are sending to people's homes if they're trying to cheat you out of your money. The reason that's important is because a lot of this research came out of an excitement during the pandemic to do more to ensure that people had access to funds from the government. But as we were designing all of these projects, it kept coming up, this idea that, like, if you're texting someone and you're like, hey, it's the government, click here and I'll give you $3,000, it just doesn't feel real or genuine. And so that really kind of helped us think through how credibility and trust play a role in government communication in a way that might be different than what we just learned from kind of basic communication studies. So let me summarize, and hopefully we have time for questions. We are putting forth this idea of a formality effect, where we define formality on these 2 axes, linguistics and aesthetics, and we show that it's consistently recognizable and conceptually distinct from just complex language. We show that at least in these 3 large-scale experiments in 3 different policy domains, formal government communication outperforms informal communication. And one possible explanation is that formality is a heuristic for credibility and importance, especially for those with low trust in government. So let me stop there. And hopefully
Thank you
we have
so
some time
much,
for questions.
Elizabeth. It's great.
Did I stop sharing effectively?
I think you stopped already. Yes.
Perfect.
Great.
I'm very proud of myself. We don't use WebEx, so I'm very proud of my technical skills right now.
I will open up like 2 questions. You have like 5 minutes for that.
I have a question, if I may. So, hi, Elizabeth, and thank you for contributing to this network. It's always great and inspiring to listen to your presentations. So, I have a question linked on how bad we are at making predictions. So if I'm not mistaken, Daniel Kahneman and colleagues in their publications, they call this phenomenon objective ignorance about the future. So my question is, what do we do with these habits? Because on the one hand, we say, well, that's why experiments are there. So let's run a randomized controlled trial and see what happens. But I'm wondering if there is a more base layer at which we can think of how to incorporate in research and in practice the fact that we are very bad at making predictions.
Yeah. Oh, this is such a good question, Paula. I don't know that I have a good answer. My usual answer is exactly what you said, which is like, this is why we test it. This is how behavioral science, this is how we all fell in love with this field, because we kept discovering new ways of understanding human behavior that seemed at the same time both counterintuitive compared to the literature, but very intuitive compared to our lives, right? But that's not a sufficient answer. I guess there's two things that I think this is related to. One is how quickly we extrapolate behavior change from proxies in the things that we test. So, you know, I've been really thinking about like, why is it that we all assumed this was the case? It's because there's a bunch of studies that say like, oh, we looked at eye trackers and like you're gonna shift your attention if something has a lot of color or contrast. That can be true, but the theoretical leap between that and therefore you're gonna change behavior is one we all made in our head. And so we do this a lot in behavioral science. And so I think this is a call for being really careful with the proxies that we use. Even if the proxy is, you know, you clicked on a link, which I use in all my research all the time, whether or not that then links to actual behavior change, we're going to have to be very thoughtful about when that's the case. So that's one thing. The second, I think, is, of course, publication bias. That is a huge issue in a lot of our, in academia as a whole. I would say I don't think it's particular to our field. And so we kind of only present success stories in a specific way. I mentioned this because before we published the formality effect, I had spoken to a lot of cities and they'd be like, yeah, we tried that nudge stuff, and we tried and we made it friendly and great and really colorful. And then, you know, it just didn't work. It backfired. So we didn't publish it. And I'm like, that was actually really interesting and important insight, that because it didn't fit into our current mindset, people didn't know what to do with. So a lot of it is also how we think about publishing things that we think don't work, because that could be a whole new field of study. I don't have a very satisfying answer on what to do about this, except that I think prediction studies are really helpful for behavioral science projects. As you remember, since you've been in this field for a while, you know, 10 years ago when we presented basic behavioral science biases, people would say, well, that was obvious. We knew that already. It turns out there's a lot of things we don't know when you ask people in advance. So I don't have a good answer, except that I really like prediction studies these days. And I'm going to think more about how to use them.
Thank you so much, Elizabeth. Enjoy your retreat. And so thanks for making the time for participating. Highly appreciated. And so we'll see here like next year for sure, and hopefully before then. But thank you. Now I could move and yield the floor to Maurice. Yes, yeah, you're there. I see you. Dr. van der Wood is associate professor at Leiden University. He studies in particular how public managers bring about change to enhance effectiveness, adaptivity, and resilience of the public sector. He has kind of a broad research agenda that also informs public administration research and theory about managerial behavior in the context of organizational change, innovation, budget cuts. His research is also tightly coupled to developments in public administration practice that has practical relevance. Juris studies behavior of public managers to also advance reforms, hopefully. and mitigate negative effects and make the intended benefits materialize in the real world organizational practice. So, Joris, like the floor is yours. As usual, we have like some 20 minutes, including Q&As. We are just a little bit behind schedule, but not too badly. So.
Okay, thank you, Nicola, and thank you, Paula, for inviting me to be part of this very interesting panel. I will do my best to make up for time a little bit, but I did not time my presentation, so I cannot make any promises. I would like to, of course, now the main challenge comes with is that I also should share my slides. Let's see if this will work.
Yes, it does. Yes, we see the slides. Great.
Okay.
Perfect.
And I can also still see you, so I think everything works fine. So I would like to share some insights on a specific sort of research domain related to behavioral public administration that I work on with my team at Leiden University in the Netherlands. We broadly study behavior and decision making in the public sector, focusing on top level public managers and also on political decision makers. One of the main emphases in the research program that we have here is the role of attention. So I would like to make a little bit explicit what is the role of attention in decision-making processes in the public sector? Why does it matter? I would like to share a little bit with you some of the insights that we can derive from the research literature and from the existing theories that are on sort of attention-based policy making. And also would like to share the insights from two studies that we have conducted at Leiden University to sort of advance those theories that we built. So first of all, more generally, why is attention so important? And the answer to this question is very much in line with sort of the central insights from behavioral public administration and also the behavioral sciences more generally, is that we as human decision makers, we are not perfect. And we face a lot of limitations and constraints. And because of those reasons, decision makers often don't behave in the way that they would like to, or in the way that we would expect them. So the first thing to mention here, of course, is as Don Moynihan also mentioned in his presentation, we are not born as humans with all the information about the world available to us. So we face informational constraints all the time. And secondly, as human decision makers, we also face cognitive constraints when we try to obtain information about the world around us. We face limits in order to understand or to analyze, to compare, or to remember all the relevant information that we might want to use in order to make decisions. And Herbert Simon, I think also he was mentioned. I don't speak Italian, but I attended a bit of the international session. I think he was mentioned. I think one of the most sort of striking quotes that he had as one of the sort of founding fathers, right, of behavioral public administration, we would say nowadays, that the wealth of information that we are confronted with creates a poverty of attention. And it makes attention a very important resource in decision-making processes, and also I would say a necessary condition for policy-making processes and decision-making processes in government, in the sense that what we can attend to as decision makers, we can include in our policy responses, but what we overlook and what we don't notice, it cannot be part of our policy responses. So just sort of as a very sort of like general demonstration of such a thing, if we would consider a societal challenge such as the energy transition, it really makes a lot of difference how we would, for instance, as decision makers, understand such a problem. Do we look at it primarily, for instance, as a technical issue? Do we understand the energy transition as a problem of labor market? Do we see it as an issue of societal equity, that, for instance, the costs and benefits of the energy transition should be distributed equally across different groups in our society? Or do we understand energy transition mainly as an environmental issue? All of those different points of attention, they can really shape in different ways, I would say, the responses of decision makers. So in the project that we conduct, we separate 3 different uses of attention in decision-making processes. Firstly, issue prioritization, where we say attention means the processing of information in order to identify and to rank the different elements of the environment that require a response. So it's about deciding what do we need to respond to immediately, what can we perhaps postpone until later. Secondly, problem definition. So here we mean information processing to determine relevant characteristics and the causal origins of the issue that we are facing. And thirdly, solution generation, information processing in order to identify and to understand the different possible courses of actions that we might employ to remedy a societal issue that we face. So in each of those different decision-making phases, attention becomes a really sort of a critical element to look at. We have quite a strong tradition, I would say, in behavioral public administration of studying attention in decision-making processes. And I thought, as a courtesy to the practitioners who are attending, I could just share some of the central principles of these theories of behavioral these behavioral theories of decision making, so that you could use your time and attention in the holiday period that's ahead of us differently. You don't need to read these books next to the Christmas tree, unless, of course, you would really want to. So starting from this issue of attention scarcity that I mentioned, these theories, they tend to recognize that decision makers do not have all available information, and also they cannot attend to all information that is available to them at once. In order to deal with such an attention scarcity, they tend to make certain prioritizations, certain decisions about what do we take into consideration, for instance, in an organizational context, and what do we not. And one of the central principles here is that they tend to compare the performance of their organization to a certain aspiration level, and they prioritize those aspects of organizational conduct where performance does not meet the aspirations or goals that they might have. Those aspiration levels can be different in nature. They can be historical, where they compare performance as it is now to what it was before in their own organization. Aspiration levels can be social in nature, in the sense that they compare the performance of their own organization to peer organizations that are similar in some respect or relevant to them. And these aspiration levels can be coercive in nature, in the sense that they compare current performance to a target that was formally set by someone else who has some sense of some degree of authority over the organization. When they identify an area where performance does not meet the aspiration level, they engage in the so-called process of probabilistic search, in the sense that they start to purposefully process information in order to identify potential solutions to the performance problem that they are facing in the organization, with the goal to satisfy. So these theories recognize that decision makers tend not to continue searching until they find the optimal solution that might exist somewhere in the universe, but they tend to settle for a solution that they think is good enough. And perhaps sort of a counterintuitive conclusion from such reasoning is that if you are looking for innovation and change and risk-taking in organizations, this theory would predict that you would find such a phenomena at the highest levels in organizations that are unsuccessful, that perform below the aspiration level, rather than organizations that perform above the aspiration level. So there are quite some sort of set principles in this line of behavioral theories of attention. There are also a couple of questions that remain. I would like to point 2 of those out, and then share with you some of the studies that we are conducting in order to fill those knowledge gaps. And these knowledge gaps, they exist in the area of issue prioritization, as well as in problem definition and solution generation search. So firstly, these theories of behavioral of attention and decision making, they tend to only outline a vertical perspective on prioritization, in the sense that they state decision makers focus on problems, and a problem is something where performance is below the aspiration level. But what happens when decision makers are confronted with multiple simultaneous instances in their organization where performance falls short of the aspiration? In such situations, how do decision makers prioritize? And secondly, a second knowledge gap, I would say, is that these theories, they tend to articulate that decision makers engage in a search for potential solutions, but overlook the possibility that decision makers might also be interested in processing information that is about the characteristics and causal origins of the problem that they're trying to address. So I would say one of the more famous behavioral scientists that we know, Albert Einstein, famously said that the formulation of a problem is often more essential than its solution. So we are also interested in the question, when confronted with performance below aspirations, how do decision makers allocate attention between these two distinct search objectives, problem definition and solution generation? I will share with you some of the insights from the studies that we have conducted. I will not go fully in depth in terms of theory and methods, but just try to cut to the chase. So in our study that we have conducted on issue prioritization, we are interested in the questions how prioritization decisions that decision makers make on a day-to-day basis, how these are influenced by the characteristics of the performance information that they rely on. And we state that information can have all sorts of characteristics. For instance, it can be information that is sourced from the internal organization or is provided by external actors in the environment where decision makers operate. Performance information can be subjective in nature, such as satisfaction from citizens, or more objective. Performance information can be compared to different types of aspiration levels, as I've explained before, historical, social, and coercive aspiration levels. And some performance information is more complex in the sense that it requires a more cognitive effort in order to process than others. So we conducted a discrete choice experiment with 1,194 local government decision makers, in which we provide them with a scenario in which they must prioritize between two different roads that both face performance issues. The roads are not good in some sense, and we ask them, which of these roads would you prioritize for maintenance? And we randomly vary the characteristics of the information that are provided about these roads. So to give you an example of the choice set that we gave to these respondents, road A, for instance, is characterized as that the performance evaluation was conducted by experts from the own municipality, and that it was based on objective measures of road quality, the International Roughness Index, which is sort of the measure that is used internationally to determine how smooth or rough a road is. And this report compares the quality of the road to neighboring municipalities, whereas road B is a performance evaluation that is conducted by experts from an external organization. It measures roads quality in a subjective way as citizen satisfaction, and it compares the quality of the road not to neighboring municipalities, but to the quality of the road 2 years before. So we ask in a series of these scenarios each time our respondents to indicate which type of these performance problems would you prioritize over the other. And we find that the way that these performance issues are articulated has quite significant influences on the decisions that these decision makers make. So we find that decision makers are most likely to prioritize those performance issues that are signaled through information that is provided by internal actors, that is expressed in objective rather than subjective performance measures, and is compared against coercive aspirations. And also our respondents tend to have a preference to prioritize the performance problems that require lower cognitive efforts rather than higher cognitive efforts to process. Second study that we conducted is in the area of search. So how do decision makers try to fill their informational needs when they are confronted with a performance problem? So we ask the question, does exposure to performance below aspiration strengthen the attention that decision makers have for information about the problem, as well as potential solutions that could remedy a problem in their information, in their organization. For this study, we rely on a different sample of roughly 700 local leaders in local government organizations, and we present them with factual information about the budgetary performance of their organization. We provide, we separate them into a control and into a treatment condition, where in the treatment condition, the information that they receive is identical to in the control group, but we also incorporate the pill, if you will, in the sense that we inform them whether or not their performance is worse than similar organizations around them. So we provide them with information about their performance relative to the social aspiration level, with the expectation that this will increase their attention for problems and for solutions that they face. So after they read this scenario, we provide them with what you could deem an a la carte menu of different information topics that they could read about, and which consists of factual information that could help them to navigate this issue in their organization. And then we measure the total time that they take in order to read this information that they choose from the menu. Just to give you a sense, this is one of the information topics that they could read, that, for instance, provides them with information about what could be a good strategy to realize financial cutbacks in their organization, which is taken from, as an example, from a successful peer organization in another country. And we find in this study that exposure to performance below the aspiration level increases attention, but unequally across problems and solutions. So comparing the control to the treatment condition, on average, we find that the problem definition search that our participants engage in increases from 51 to 56 seconds, which is an 11% increase, while the solution generation search increases from 41 to almost a full minute, which is a 44% increase. So our conclusion here is that this exposure to performance below aspiration really drives unequally search for information about the problem at hand versus potential solutions to this problem. So I formulate a couple of takeaways in the area of issue prioritization for practitioners. I think it's good to have an awareness that the type of information that you rely on probably will influence the probability that you will attend to an issue, and could also influence the chances that when you present an issue to your peers in your organization, that they might attend to it. So it's perhaps something that could be used strategically. For researchers, I would say we need a bit more replication of these types of studies across policy domains, because we analyzed a quite specific case. In the area of search, for practitioners, I would say it's perhaps a good idea to reflect on these types of informational patterns, these search patterns, and if they apply to you. Do you perhaps also jump to solutions when confronted with a problem, or do you look before you leap? And perhaps also a good idea to consider the decision-making routines that you or your team relies on when attending problems. Is there enough consideration for problem-related information in such a routine? And is this something that can be amended? For researchers, so for my colleagues and for myself, we would like to conduct research on behavioral interventions to strengthen attention for problem-related information when decision makers address problems. And also, we would like to more broadly, perhaps more ambitiously answer the question, does a better understanding of a problem also result in better policy solutions? That's all I have for you.
Thank you so much.
Thank you for your attention.
Very rich presentation. Thank you, Charis. Lots of relevant questions. It will take us like the next years to answer. So
Yes. I still have funding for 4 years, so we can
directly related to my field of work as well. So thank you for sharing. We don't have much time for questions, but I wanted just to ask one, if I may.
Yeah.
Do you already have some sense whether or not there is some or significant heterogeneity in the effects of attention issues? I mean, within the specific, of course, sample.
Yeah.
But did you observe any differences in attention issues?
Yeah, so one of the, I think perhaps for the public sector, more interesting, or what I find at least interesting sources of heterogeneity is the decision-making role that our respondents have. And behavioral theory of the firm, this does not really specify this, but in the public sector, of course, we regularly distinguish between decision makers in a more political versus a more managerial or bureaucratic role. And we have a variation across these roles in all of the studies that we conduct. We also theorize and test about it, but I left it out of the scope for this meeting. So the short answer is that in these, and I think part of the explanation here is also because we utilize these rather clinical, abstract survey experiments, and a lot of this variation in decision-making role is institutional. But we tend to find relatively small and often insignificant differences between politicians and managers. So for the study on search behavior, we find that to a very similar degree, politicians and bureaucrats both tend to have this tendency to be become more interested in solutions rather than in more problem-related information. For the study on issue prioritization, we find also that the sort of the stated preferences, like what kind of problem would you prioritize, are quite similar. The main difference there that we find is that this tendency to want to rely mostly on objective information is much stronger for bureaucrats as compared to politicians, whereas politicians tend to value perhaps a little bit more the experiences and the opinions of citizens, whereas bureaucrats are much more likely to ignore those and sort of want to stick to the facts.
Super interesting. So thank you so much, Charis, for being with us today. Now I will turn the floor over to Marianna Baggio. Dr. Baggio currently works as a policy analyst at the Competence Center for Behavioral Insights, I think still there, of the European Commission Joint Research Center. She has worked on a range of research topics and projects across different areas: health, green energy, charitable giving, voting, and impact finance. Currently, she mainly focuses on behavioral insights for health policies, including vaccination, cancer prevention, and donation of substances of human origin. So thank you, Marianna, for being with us today. The floor is yours. You have some 20 minutes, including some time left if you want for one question or two at the end.
Okay, good. I'll try to recuperate some time as well, so we don't overburden the people and stay too long. So at the Competence Center on Behavioural Insights, we are part of the Joint Research Center of the European Commission, which provides evidence to policymakers at the European Commission for different directorates general that need scientific support in designing and developing their policies. And I think we would all agree that society is facing many challenges, which are quite articulated and complex, especially when we look at the perspective of the European Union. And we had just a couple in the past few years that were like quite dense and intense for us to tackle. Think of the coronavirus crisis, think of the invasion of Ukraine from Russia, but not only, we have challenges that are looming, like artificial intelligence, how it's going to impact our workers and our lives, biodiversity, I mean, you name it. So for us, these new challenges have really shown how much we need evidence to inform policymakers and how much science is key in order to make policies that are sound, strong, effective, and that also are lasting in time, so that they are not outdated in 1 year or 2 years because something else has come up. So it's also a future-proofing the policies that we make, and we need evidence and we need science in order to do that. And all the different areas of science that are really so many that the European Commission taps into, from chemicals in our food and agriculture to reference materials to nuclear development. There is also something that it is across all of the policies that impact EU citizens, and it's really understanding how people behave as individuals and then in groups, because they are quite often the final recipients of the policies that we design, and we want something that is made around them, that works for them, that it's really effective, and that takes into consideration everything that behavioral sciences have discovered in the past years, and so that really the design is at its best, so to speak. Now, how do we apply behavioral sciences in the European Commission? Of course, the European Commission is quite unique, although there are so many institutions around the world that apply behavioral insights in public policy, and mostly are national or the local level in terms of behavioral units. Some are also at the international level. There are at the UN, at the OECD, all the agencies of the UN, so like the WHO, for example, has quite a strong application of behavioral insights. And then there is of course us as well. But for us, we are quite unique compared to other international organizations, because we have such a large number of areas of competence. First of all, we also have very peculiar policy instruments, so directives, regulations, communications, that they are quite specific to the European Union. So what we can do is limited to what is set up in the treaties as well. But we also have this sort of reduced proximity to the citizen, but we also have so many citizens. We have 450 million inhabitants in the EU that are affected by the policies that we design. But we are quite often not the ones that are tweaking the design of an intervention, but we more often set the boundaries. And if you think, for example, of tobacco products and the labeling of tobacco products, the directive was setting the boundaries, and then each member state applied it in the way that they felt was better fitting their member state. So you have very anonymous cigarette packages in Belgium, for example, while in Greece you still have the branding and the fact that you can have very nice and thin cigarette packages, while in other countries you can't. But we also have regulations that set very clear rules. So for the pre-checked boxes in online purchases are forbidden, and that's the same everywhere in the EU. So we are also we have different ways of tackling into the behavior, and sometimes they're a little bit removed, and we can only set the direction of how we apply this. So at the EU Policy Lab, which is the unit where we work, it's a place where we try to make innovative policy making by applying a number of different approaches. So foresight, how the world is going to look like, so the policies are future proof as well, and we can anticipate what's going to happen. We have design for policy, and we have behavioral insights, so that the policies that we design are more effective and efficient, and we don't only apply economics, but also psychology, sociology, anthropology, neuroscience, so different approaches to behavioral sciences, not only behavioral economics and experimentation. For the European Commission, behavioral insights in the policy cycle can happen at different stages. Mainly when we talk about preparation, the main issue that we have here is that the policy cycle runs at a much faster speed than what the scientific cycle is. So scientists need more time compared to policymakers, and this is quite a challenge for us, but also for policymakers to get in time the evidence that they need. And this is a challenge that we've seen not only for us, but also for behavioral insights units at the national or local level. So this synchronization between the cycles of science and policymakers. We try to make our policymakers think about the behavior of individuals and group in a systematic way. So we created a little tool, we call it the Do It approach, where we tell them to define the behavioral element, to observe it, to identify the options that address that behavior and to test it in a way so that they don't only plug in behavioral sciences as a tool at the end of the policy cycle to try and sell better a policy or to try and adapt it a little bit better to people, but something that is rather a lens where you can identify a policy issue from the very beginning, and you can study it and you can design the policy, and throughout this policy cycle you are encompassing also behavioral sciences. It can also be that the solution is not really behavioral driven, or it's not a behavioral intervention or a policy, but like a more classical kind of intervention, like for example a tax or an incentive. But still, it is important that behavior is understood very well from the very beginning of the thinking and creating a policy and identifying what is actually that we want to address with our policy. We have applied this to many different policy areas. So we are working a lot on artificial intelligence, on the Green Deal, on consumer protection, gender equality, but we've also been working on understanding how the solidarity towards Ukrainian refugees is actually, being is evolving in time with a war that is lasting probably longer than we expected, and does this fade in time, and how we can address it, because it was also impacting our lives as well. We have here briefly two examples that I wanted to bring to the table. One is on gender equality in the labor markets, because we still have a very lingering gender pay gap in Europe, but also many other statistics around, the differences between men and women in the labor markets are staggering. Women work less hours, but they work more at home, and overall they work more hours than men. If you add the paid and unpaid work, they participate in the labor market less. There are less women in managerial positions, so there are still gaps that doesn't matter if we made a lot of progress, they're still lingering. So we are trying to understand what are the behavioral drivers behind it and what can we do at the European Commission level. We tend to accept more what has been offered from our employers, even if the offers are unfair. We tend to be averse to competition and to risk under certain circumstances. We know that this is not always true, and it depends on how we design the environment where we ask women to compete. They tend to be less confident, and there is a large gap also in self-evaluation and self-promotion, which we think explains quite a big part of these differences also that keep on lingering. And therefore we've done three big experiments. One that's been published in 2022. So it was reaction to gender pay transparency. How do men and women react to having transparency in pay? And we found very interesting dynamics here that where women tended to compare themselves not very much to men, but to other women, and to react more if the wage inequality was, compared to other women than to men, in sort of justifying the differences between men. They were not outraged, but if it was with another woman, they would be a little bit more proactive in asking for a rectification of this difference. We are now submitting a paper on equal employment opportunity statements. So how do those statements that we put in job advertising really work, and are they detrimental for men? And no, they are not. We see that they are actually a good signal for both men and women that work environment is probably more balanced also for men, which is something that they tend to want more nowadays. But we are also working on paying and hiring gender discrimination. So that's another area of where we're working. We've been working also a lot on vaccination acceptance and demand, from the EU digital COVID certificate to how Europeans were perceiving refugees coming in, probably without a vaccination. Was that the issue or not? So we really try to have a pulse of the situation in terms of Europeans' acceptance of vaccination regarding COVID. We had a nice paper on how they were projecting how the pandemic would develop, and which was of course linked to vaccination acceptance and demand. So people thinking that the pandemic was finished or there was not a next wave would tend not to plan for a vaccination, rightly so. I mean, it was coherent with their beliefs, but this was this fed into a communication that the Directorate General on Health did, where they warned member states that they have to be really clear about what are the projections of the pandemic in terms of next waves and number of cases if they really want people to engage in vaccination behavior. Otherwise, people will not really see the need for a vaccination itself. So I think that was a way that we did not design a policy, but a communication, which is still very important. And also because this then ties in with some mis and disinformation that we've seen. I think this was really helpful for policymakers in terms of on planning their communication messages in critical times. Other policy areas, I've linked them here for you to have a look if you're interested. We've done a lot on waste and waste sorting, which is something that the EU, they want to harmonize, but also about reducing consumer food waste, front of pack nutrition labeling, so the Nutri-Score, quite a wide range of areas. So just to conclude, I think it's nice to see that we can apply behavioral sciences to a wide range of policy issues at very different levels. Can it be for designing a regulation to informing a communication? And I think that the challenge that we share with other behavioral units is that it's quite not difficult, but it requires a lot of scientific lobbying in order to be able to have the scientific process starting in time to be properly fed into the policy cycle. And I think that's very important. Sometimes we feel like we're not really doing that. We are scientists, we don't do lobbying, but it is an important part of our job if we want our evidence to be taken into account and incorporated into policy making.
Thank you so much, Marianna, for this update on the activities you're carrying out at the European Commission. I think we have a question from Paula.
I do have a question, if I may jump in. So first of all, thank you very much, Mariana, for being with us. It's always fascinating to listen to your presentations. Of course, you contribute a unique and highly valuable perspective, which raised the bar for us as scientists and also as EU citizens. So I was wondering if, based on your perspective, over time, you have seen, government organizations or perhaps organizations within European countries really paying attention to how we can apply behavioral science insights and methodologies to study very different domain. Thank you.
Thank you for the question, Paula. I think, yes, we've been doing a little bit of work now in mapping the efforts of behavioral scientists in government, especially in those countries of the U27 that are historically less prone to apply it, because there are some countries that clearly have more of a culture of applying behavioral sciences. So, for example, the Netherlands, Finland, but there are countries that are maybe smaller and have less resources. So, for example, Slovenia or Portugal, that have these, seeds of behavioral insights units that need to be helped. So we are talking to them in order to see where we can help them as well in growing this kind of approach, because I think it's very important, because if we talk at the EU level, if we have a directive that it's founded on behavioral sciences principles, and then the member states have to bring it in, it makes sense that they also have the expertise to make the most out of the setup that we've created for them, right? So we are working with some member states in order to try and, boost their efforts. And I think it is important from our side that we provide that platform that, or the seal of approval, that we say this is a good effort, you should keep on funding it. And if it comes from us, for them, it's an extra card that they can play to try and bring these kind of initiatives forward. So I would say that there is an interest. It's very varied across EU member states, and we are trying to help those member states that have less of a traction, for a number of reasons, to move things even forward and get more funding and get more personnel and on and on. So yes.
Well, thank you so much, Mariana. So we will be with us also for the last session in Italian, so we have this advantage. I will now yield the floor to Shelley Metzenbaum. I see you there. So Dr. Metzenbaum is currently involved in the BETTER project, which stands for Bringing Everyone Together to Enhance Results. She works with governments and also other organizations to help them understand how to use and communicate data, goals, analysis, and relevant research to improve real-world outcomes. During the Obama administration, Shelley served as Associate Director for Performance and Personnel Management at the U.S. Office of Management and Budget. After that, she was the founding president of the Volcker Alliance, an organization launched to increase attention to and excellence in government policy implementation. So not just formulation, we go back to the implementation gap thing. So Shelley, so the floor is yours. If you have like 15, 20 minutes. So
Thank you very much, Nico. Can you load my slides, please?
Yes.
Thank you. So I'm thrilled to be here with all of you and to have been able to listen to some of this research. And I'm going to put in a plea, because I come to you as a practitioner. And this research is oftentimes not easy for us to find, and we don't have a lot of time to look for it. I'm not sure I'd know about this if I weren't married to an academic. So, it is really fantastic that you're doing this work. And I want to challenge all of us to think about how do we get what you're finding to the folks on the ground who can use it. So today I want to talk to you about the power tools of government and also nonprofit organizations, public service organizations, and talk a little bit about the why and how of performance and evidence-informed management. Next slide, please. So Nico mentioned the Better Project. The Better Project is pretty much me working in partnership with a lot of other folks. I'm not creating a big organization. I work with folks like the National Academy of Public Administration, the National Head Start Association. But why did I even call it this? And I have a website if you want to look at it, but bringing everyone together to enhance results. When I was at the U.S. Office of Management and Budget, the program managers and the folks who were and the performance managers and the evaluators didn't talk to each other. They didn't work together, right? And then beyond that, and one of the things that was really distressing was seeing people talk about funding what works and defunding what doesn't. Or in the Bush administration before the Obama administration where I worked, they would talk about demonstrating results. But for whom? For what? Why am I demonstrating results? And I want to argue to you, those of you who are listening who are practitioners, those of you who are researchers to help us on this, that the primary use of data and evidence is not to find what works so you can fund it or to demonstrate results, but to inform where government should focus. And we had earlier presentations on prioritization, problem identification. And then once you've figured out where you want to go, to find ways to do better and then increase adoption of those ways. I also think that we ought to think about how to communicate this, both to inform focus and do better, but also to build understanding of and trust in government. Way too often we think about using data to allocate resources and motivate better performance. But in fact, if you actually pay attention to both the experience and lab evidence, if you don't do that intelligently, people will be afraid of the data. They'll run from it, they'll fight from it, they'll advocate to dismantle measurement systems. So I urge us to think about how to do this. I mentioned a few areas I'm working on, the data design initiative of the National Head Start Association. This helps very low-income children, and it funds child development centers, and they have to report on like 700 performance standards. What does that mean? And my first question when they were reporting on 1,400 performance standards before we got the regs changed was, hey, how do you use the data? What kind of analyses get done with the data help you to decide what to do next? And the answer I got was, we don't. We just send it in to the funders. Intergovernmental arrangements. Mariana talked about the complexity, in the European Commission. Well, in the US government, we're a federalist system. We give money to the states, et cetera. How do you make the intergovernmental arrangements work well so you improve outcomes in very different political cultures? And then more useful oversight. We have very heavy inspectors general in the United States. We have audit requirements. We have all this stuff. How do we make that information useful and not, in fact, just fear creating? And then communicating the counts. And, someone talked earlier about attention getting. How do we communicate the accounts, both data analyses and evidence findings? So that's what I want to talk about today. Next slide, please. So why do we want to do all of that? And I argued, as I said before, it's to improve outcomes. It's to improve operational quality, and that includes fairness. It includes the ease that Pam and Don were talking about. We want to improve the operational quality and build understanding of and trust in government and those government funds. Next slide, please. So then we have the power tools. So I'll go into these a little bit more, but let me introduce them to you. Goals, both the setting of goals and the using, performance measures, and lots of other kinds of data. Data analyses, including data visualizations, well-designed trials, communication and community, and motivational mechanisms. Let me argue to you, to those of you who are in government or working with government or trying to help government work, that government needs to use all of these 6 power tools and use them intelligently. Researchers can help us, government, learn how to use them intelligently and how to avoid using them in dumb ways. But we need that research, and we need that research communicated to the field in ways that get their attention, that get their understanding, that retain that understanding so they can apply it. So, next slide, please. So what are the uses of data? And again, inform where to focus. So we were talking about prioritization. We are talking about long and short term, both big picture and locally. We want to use data to inform, what the goals and targets should be, whether it is a 5-year goal, a 10-year goal, or it is today's task. Which kids should I help? Which regulated parties should I inspect? Which problems should I issue regulations for? That's what data analyses really help us do in government. And you cannot do everything. You really need to decide where to focus. So that's one of the big uses of data. And we need that data translated to decision makers in ways they can think about, hey, this is an area where I ought to pay attention. And then find ways to improve, which means we need to collect data in ways that let us find the positive outliers. Who is actually doing better than those who look very similar to them? How do we also do well-designed trials, whether it's a randomized control trial or another kind of trial, a one-arm trial that's well-designed? There's test marketing that goes on in companies all the time. We can do test marketing in government, integrating well-designed trials into our operations if we have data systems that help us do that, which means, and high level and more granular, we really need to think about how we collect data to make it useful. Once we find better practices, we need to figure out how to increase adoption of them. So, in the private sector, you've got marketing and salespeople doing this. What do we have in the public sector that helps us find these better designs for the forms that Elizabeth was talking about? How do we get that? And then how do we reduce the use of less good ones? Because, hey, it's very popular to do those pretty colorful forms now, but maybe they're not going to be as effective as you want them to. We also want the data to inform individual and organizational choices. So I don't know if any of you read New York Wirecutter or you used to read Consumer Reports in the United States. Those are big consumer comparative organizations that actually say, hey, which computer do I want to buy? Which cell phone plan? So you want to inform individual choice as well as organizational choice. If I'm a school system, and think about schools, European schools and other schools in other countries, in other areas, they outperform American schools in a lot of places on the international testing scores, right? But what do they do that's different that maybe American schools could pick up? And which of our American schools do better? Turns out it's the Chicago Public Schools outperform most others on 3rd to 8th grade growth education scores. However, they still haven't caught up with the better programs. That's probably very much resource related. So really helping to inform those choices so that the debates that go on, the policy debates, take a look at this. And then build understanding of and trust in government and the organization's government funds. Next slide, please. So who could use this data? Well, in a lot of cases, the research and the data analysis go to other researchers. But in fact, you're doing that research because you want to get it to the front line. Even though we got, as Elizabeth, talked about the positivity bias, you got screwed up incentive systems for researchers in terms of publish or perish and things like that, as opposed to relevance. Maybe we can start to get academics judged on the relevance of their research. That would be fun. But we have to think about the folks on the front line. They need to have the data decide, as I said, whom should I enforce against? What rules should I write? When I take actions, are they better than other actions? You have central office operations. You have policy decision makers, those choosing among options. You have suppliers. Hey, you know, maybe somebody out there has a really good product to sell to the federal government or the, you know, a European government, an Asian government. Who's got better products? And how do we help them know where we need better products by giving them a sense of our goals and our data? And then goal allies. So in the US federal government, we put out last year under the pandemic, $1 trillion in funds to state and local governments and nonprofits. We have foundations that care about whether it's the UN Sustainable Development Goals or other goals. And we have people out there who care, who might actually want to step forward and help. And that's, I would argue, especially true in a world where a lot of older people are healthy and not working full time. And so they have time maybe to help. How do we enlist their assistance? So let me talk about 4 different uses, 4 examples of uses. Next slide, please. So what is this? You all may be familiar with this. This is John Snow, I believe. And John Snow in 1854 mapped cholera cases in London. And see where that red line is? That's where the pump is. And he noticed they all clustered around a pump. And so he convinced the London decision makers to take off the handle of the pump. You can still see it in London today. And lo and behold, cholera cases declined. So great, it was fantastic. And in fact, it made a difference. However, as Edwin Tufte has pointed out, if you take a look at this graph over here on the left, it's not clear actually that cholera declined more after the handle was taken off. There may have already been, so he thought it was water-based, and in fact laws and science has since found it was water-based. But I share both of these analyses because usually when we're doing assessments of things, we want to look at the data from multiple perspectives. And you know, so it's important to bring all of that in. Was cholera a cause of was contaminated water a source of cholera? Yes. Did taking the handle off make all the difference in the world? Maybe it did, and maybe it didn't. So next slide, please. What are you looking at here? What you're looking at here on the left side, April 1996, this is photographs taken of the state of Massachusetts. Back in the mid-1990s, we used the capital budget. I'm from Massachusetts. I happen to be running the capital budget. I'd never heard of a wetland. A wetland is a swamp, it's a bog, it's, you know, all these wet places. When I first heard about it, I said, those are mosquito breeding areas. Why are we saving them? And then I had a very smart deputy who told me because they help with flooding, they help with water quality into larger receiving bodies, and convinced me that we should fund the purchase of plane time, camera people, and then researchers to look at the photographs, the high resolution photographs, and, you know, look at and identify and map wetlands. What do you see on the right side? Well, satellites went up, photography got much better. You now have all these fancy, easy to look at photos. We all have Google looking at our houses. And Massachusetts, probably the same guy who talked me into it, you know, who put in the request to fund the capital budget, Massachusetts can now digitize both sets of photographs, and where you see the red sign is where there was wetlands loss. Why is this important? Because the woman who is head of the wetlands program will tell you that when they did this, 90% of her staff was working on wetlands permitting. The other 10% of her staff were inspecting wetlands permit holders. 90% of wetlands loss was in places that had never bothered to come in for a permit. So again, where should we focus? How should we allocate our resources? This is very different than saying, is the wetlands program successful? It's thinking about data as useful. And too much of the stuff that we talk about when we talk about evidence-based management, performance management, it's like this demonstrating results. No, it's about useful data, making it useful for multiple uses and multiple users. Next slide, please. So what are you looking at here? This I found when I was looking at a notice of funding opportunity for lead poisoning for tribes, for tribal people of tribal locations. The Native Americans still have very high lead poisoning. And so basically what you're looking at here was found at a plan that had been done, organized not around an agency, but rather organized around an outcome. In this case, lead poisoning. And this was an EPA strategic plan for lead poisoning, for lead reduction, for reduction of lead in people's blood. And what I love about this, and as we talk about, hey, does government work or not? This is not an evaluation. What it is it shows you trend lines in the date of government action. Now, did those government actions actually result in all those improvements? I don't have proof that it is. This isn't a controlled trial. What I see is a very compelling case that, in fact, government actions probably reduced lead poisoning. Now, what you don't see here that's kind of interesting is a comparison to countries that never allowed lead in their pipes in the first place, which is true in many European countries. So if I compare it to other countries, I would not see, I'd love to see another graph comparing lead poisoning in the United States to lead poisoning in other places. So it's just, how do we visualize this? How do we communicate it? In this case, this says to me, man, I'd like to see this for every government outcome objective, to give me a sense of what they tried to do, what the trends have been. And so that I understand the role of government, because frankly, there's a lot of people arguing against government and trying to downsize government, et cetera. And it's much sexier, as if you're an elected official, to talk about cutting funding, as Doris was talking about, reductions. But hey, let's remind people why government matters if we want them to keep paying for it. Next slide, please. So this is Nico's research, and it's 3 different visualizations of this same data. And I think it's fascinating, and Nico's done great research. I'm very excited about it. But what it's like is like, oh, how do I interpret this? What do I do with this data? So how you communicate the data you collect makes a difference. In this case, I don't know if it would actually make sense to show all 3 visualizations and bring them into a meeting and get people discussing them, because we all have different brain types and different people may say different things. So you can decide what to do next, both where to focus and what to try next, what actions to take, bringing in other evidence. Next slide, please. So let me recap quickly on what we've got here, goals. This is one of the power tool number 1, goals, and it's both the goal setting discipline. So in the US government, we require every federal agency to do both a strategic plan, which is longer term, and annual plans with goals in them and strategies in them. But that goal setting process introduces the discipline of deciding what you will and what you won't do, because you can't do it all. And then writing the strategic plan, the annual plan, and you can go to our website, performance.gov, and find all those strategic plans and annual plans, as well as the annual performance report. It communicates the focus areas when collaboration is needed. And having the goals and talking about them all the time continually reminds people, why are we doing what we're doing? So we're not running on autopilot. And then we need performance measures and other data to make sure we're moving in the right direction near long term. And if not, to sort of get the question, hey, why not? And if so, we want to say, hey, can we do more or get more bang for the buck? But it's not just the performance indicators that make a difference. It's other data. We need contextual data. We need data for correlations to help us with causality analysis, for prediction, as warning signs. Constructive comparison. And I talk about this, I put constructive always because comparison is too often done to embarrass folks. And we need to really think about that. And then I also mentioned the unwanted side effects. Some of you may know about CompStat, which was the New York City Police Department's effort to focus on crime rather than police response times, which was very successful. And they had frequent meetings looking at the data, but they didn't pay enough attention to the complaint data. They did bring it in, but they didn't pay enough attention to it. And so, especially since they had this theory that was called broken windows, where you thought small incidents were a problem, well, what you saw was a lot more police stopping and frisking and things like that, and doing it with bias, racial bias, etc. You also had measurement manipulation, whether it's at the schools or the cops. We've seen measurement manipulation. So if you're going to do this, you've got to manage, you've got to measure that manipulation, the validity of the data, right? And make sure you're not encouraging the frontline guys to give you what they want. We had teachers and school systems fired. Data analyses and well-designed trials. So data analyses, including visualizations and different kinds, and the well-designed trials. Next slide, please. 2 other quick points. One is communication and community. Where do you communicate? How do you communicate? I mentioned all those users. How do you get data-informed discussions, but also longer writings? That's what you've been writing about. Signs, video, social medias, influencers. We got to figure out how to communicate what we're learning and how to make sure those communication efforts are working well. And that's one of the things some of you are doing. And then next slide. And then one of the biggest challenges is the motivational mechanisms. Way too often, we make people afraid of data. Did you meet your target? Well, if you're going to reward me for meeting my target, I'm going to pick a target I know I can meet, right? I'm not going to, I'm not going to pick a stretch target, even though there's robust research that says stretch targets, well chosen and well resourced, are actually improve performance. There's the risk if you link performance measures and some kind of reward is you'll drive out the intrinsic motivation, the mission motivation. So we need to think about how to structure motivational mechanisms, whether it is organizations or for people. And we haven't done that well. And then we need to, as Herd and Moynihan were talking about earlier, we need to take on the layers so they don't overwhelm efforts. We actually need to tackle them as part and get rid of those layers where they're a problem. So final slide, please. Better, let's remember, it's got to be useful, to lead, to learn, to improve outcomes and operational quality while building understanding of and trust in government. So thank you for the opportunity to meet with this spectacular group.
Thank you so much, Shelley. I think you did a great job also in connecting the dots between previous presentations. So thank you so much. And I want to thank all the international speakers. Now we'll move to the final wrap-up session in Italian. So you're very welcome to stay with us, but it'll be a little bit tough maybe to follow. Grazie a tutti quelli che ci stanno anche seguendo e a coloro che sono insieme a me dentro WebEx. In questi minuti finali vorrei semplicemente lasciare il campo libero per riflessioni rispetto agli stimoli che abbiamo avuto, oppure rispetto alle sfide che ciascuno sul lato ricerca o tra i practitioner si trova di fronte relativamente al fattore umano. Questo è utile per disegnare la rotta, no, delle ricerche future che qui conduciamo a supporto dei sistemi sanitari della regione Toscana e degli altri e degli altri sistemi sanitari e delle organizzazioni pubbliche, soprattutto regionali. Inizierei, se siete d'accordo, con Marianna, che ha fatto anche la sua relazione. Poi lascerei la parola a Luciano Lippi, che vedo collegato, è il responsabile del personale del servizio sanitario regionale, della formazione, delle relazioni sindacali. Poi Giorgio, Paolo e insomma in un ordine che riteniamo. Prego Marianna, una battuta finale, una riflessione.
Grazie mille. Noi a livello di Commissione europea adesso stiamo affrontando un progetto in cui stiamo raccogliendo proprio le iniziative che vengono fatte anche in Italia a livello di applicazione di behavioral sciences per spingere un po' le Behavioural Insights Unit nell'area della salute. E un po' l'idea è questa di mappare i diversi sforzi che ci sono a livello europeo e uno dei paesi è l'Italia, anche per dare poi un supporto di tipo anche non solo scientifico, ma anche politico, no? All'applicazione di questi principi, che credo sia molto importante e credo che questa sia anche una delle sfide, no? Nel momento in cui magari questi approcci passano, tra virgolette, passatemi il termine, un po' di moda, magari passa un po' questo interesse così dettato magari dalla vincita di un premio Nobel o quel che è, riuscire a trasformare questo approccio in qualcosa che è consolidato e che può anche aiutarci a affrontare delle sfide future come la crisis preparedness, quindi per il cambiamento climatico, tutte anche le implicazioni che ha a livello di salute, l'aumentare dell'età dei nostri cittadini, quindi noi vediamo un'importanza sempre crescente dell'applicazione di questi principi e l'idea è un po' anche di aiutare a livello proprio di politico e di giustificazione sull'utilizzo di questi principi, non solo a livello scientifico. Quindi questa per noi è un po' la sfida che vediamo per il futuro, sulla quale intendiamo lavorare.
Grazie infinite Marianna. Luciano, prego, se vuoi fare una riflessione sulle sfide che tu dalla tua prospettiva ovviamente di responsabile del personale ti trovi di fronte, no? E come possiamo essere d'aiuto. Ecco.
Sì, innanzitutto buonasera a tutti e mi scuso di non essermi potuto collegare nemmeno alle 14:30, però sono momenti abbastanza concitati qui nella sanità regionale. Non so per chi ha letto, insomma, le pagine dei quotidiani locali, abbiamo un po' di problemi di tenuta finanziaria così. Le sfide quindi su questo aspetto, la parte economico-finanziaria non è che sia, è, diciamo, un petalo della sfida, perché poi abbiamo altri pezzetti di sfida che sono ben più complessi, che appunto hanno a che fare proprio con l'organizzazione e la gestione delle risorse umane. Perché noi la sfida più grande che abbiamo è quella di rendere, ovviamente io parlo per il servizio sanitario regionale pubblico, ma anche nazionale nel più ampio contesto, è quello di renderlo attrattivo per poter avere, diciamo, e valorizzare le risorse umane, quindi il capitale umano e in particolare i professionisti sanitari, perché al di là di tutte le varie, ora non so se vado fuori tema o rispetto a quello che
No,
avete
vai,
parlato,
no,
comunque
vai,
ecco,
vai.
noi abbiamo questa grande sfida, grandissima sfida, perché come dicevo, al di là delle varie, come dire, veline che si possono mettere davanti agli occhi dando la colpa all'imbuto formativo, l'università, tutta una serie di parte che fa la formazione, il numero chiuso e quant'altro, però di fatto i professionisti vengono formati, ce li abbiamo, però poi non siamo in grado di trattenerli in Toscana, trattenerli in Italia, perché c'è un fattore economico, però come abbiamo anche analizzato anche nei vari corsi e seminari che facciamo, effettivamente la parte economica non è al primo posto tra i desiderata dei nostri ragazzi, i nostri studenti, dico ragazzi perché ormai i baby boomers sono ormai un ricordo, io sono un, un, come dire, un soprammobile perché bisogna lasciare il posto ai nuovi e hanno nuovi orizzonti, nuove possibilità, nuove opportunità, nuove ambizioni, nuove competenze, nuove skill, soft, hard e quant'altro. E quindi noi dobbiamo fare una riflessione proprio a livello di sistema. Sarebbe bella poterla fare a livello di sistema nazionale, però perlomeno cerchiamo di farla a livello regionale. Ecco, su questo ci stiamo impegnando proprio per cercare di ottenere dei risultati importanti con tutti i vari sistemi. Noi abbiamo messo a punto alcuni esperimenti che hanno avuto anche un eco nazionale, tipo il progetto Anch'io all'Elba, proprio per andare a collocare i professionisti, i dirigenti medici in un ambiente dove chi se lo immagina come la morte civile, no, ma dall'Elba e non mi ci tolgono più. Mentre invece noi cerchiamo proprio di valorizzare e rendere la rete della formazione, la rete dell'expertise, la rete anche delle aziende sanitarie ospedaliere che contribuiscono a questa opportunità. Quindi la sfida che ci vede in campo è proprio questa, di cercare di ottimizzare, di rendere una narrazione diversa sul servizio sanitario regionale affinché i nostri giovani, i nostri studenti, i nostri laureati possano dire faccio il medico in Toscana perché ho un qualcosa che mi rende felice, mi dà delle opportunità, mi fa essere competitivo, mi fa essere esperto, oltre ovviamente alle cose che ormai si danno per scontate, lo stipendio e quant'altro. Ecco, un po' la sfida che vogliamo affrontare nei prossimi anni per noi è questa.
Grazie Luciano, questa sfida durissima. Giorgio, una riflessione sulla base anche degli interventi precedenti, insomma Giorgio è un collega di fatto, quindi ne parliamo spesso di questi temi.
Sì. Beh, intanto grazie e saluto tutte e tutti. Allora, comincio con una battuta. Io sono un appassionato di bricolage e tutte le cose che ho visto e sentito oggi pomeriggio è come entrare in un enorme negozio di bricolage pieno di infiniti strumenti. Allora, degli strumenti, alcuni dei quali entusiasmanti. Insomma, allora sto parlando, me ne sono solo notati alcuni, il tema della comunicazione efficace, di cambiamenti comportamentali, di stili di reciprocità, l'administrative burden, l'attention-based decision, eccetera. Allora, tutto questo dentro un'organizzazione sanitaria ci sta completamente, nel senso che sono tutte cose che si dovrebbero usare e provare ogni giorno, in più nelle diverse dimensioni, perché ovviamente queste cose hanno a che fare con la relazione che ci sta tra il management e l'insieme dell'azienda, ma ci sta all'interno delle singole strutture dell'azienda, quindi c'è una dimensione verticale e orizzontale e ovviamente quello di cui si sono visti anche gli esempi nei confronti della popolazione. Allora, quello che mi chiedo è come riuscire e come avere una nuovissima strumentazione e chiedersi come questo può entrare nella gestione ordinaria, cioè come può essere utile nella gestione di ogni giorno. È chiaro che non si può riempire di tutto e di più un'azienda sanitaria, però credo che una delle cose che poi state facendo, insomma, per ricerca e proprio cercare di capire come queste cose possono entrare dentro la sanità nel quotidiano, sapendo che siamo in una situazione di crisi. Vabbè, il collega Lippi l'ha già detto, noi abbiamo una situazione drammatica che esce, c'è poco da dire, anche dall'accentuazione di quanto è successo con il Covid. Abbiamo persone dipendenti anziani, dipendenti che l'unica indagine a livello nazionale che ho visto, ma poi sarà mia carenza, sul perché le persone se ne vanno e perché si sentono poco motivate, poco apprezzate, perché il lavoro gli ha rubato il tempo, la famiglia e la qualità della vita. E per quarto, rispetto a queste cose, il tema della parte economica. Allora, a proposito come si chiama, di behavioral, no? Approccio comportamentale sulle cose, noi le soluzioni che stiamo adottando sono quelle da un lato di dare più soldi, ma neanche tanti, ma dall'altro, paradosso di paradossi, dare più soldi per farli lavorare di più. Allora, sì, credo che questi strumenti che sono stati elencati oggi, ma insomma anche nei convegni precedenti, dovrebbero essere diretti, resi noti, sollecitati anche ai policy makers, cioè quelli che prendono le decisioni, e la distanza tra le soluzioni che si adottano e i problemi che si vorrebbero affrontare mi sembra che sia ancora piuttosto importante. Ecco. Questa era la riflessione. Grazie ancora dell'ennesimo bellissimo pomeriggio.
Grazie Giorgio per questo continuo, diciamo, dialogo. Adesso passiamo dalla prospettiva dei practitioner, di quelli che poi gestiscono, alla prospettiva della ricerca. Quindi ringrazio Paolo Belardinelli, che è stato con noi tutto il tempo. Beh, Paolo è un amico, coautore, fa parte del nostro, insomma, gruppo di ricerca, adesso lavora all'Università dell'Indiana. Paolo, sulla base anche di questa conversazione così interessante, degli spunti che ci hanno dato i colleghi, quali sono secondo te gli spunti per la ricerca, no? Quindi anche per il nostro lavoro insieme?
Sì, grazie Nico, grazie per l'invito, come sempre la parte introduttiva vostra già molto interessante, poi la parte internazionale che forse meglio di me ha spiegato quali sono le domande che attualmente i ricercatori si pongono nella nostra area, molto interessante, anche adesso qualche spunto da questa sessione con chi usa o cerca di usare queste evidenze, questi risultati della ricerca che facciamo in quest'area, di nuovo molto interessante. Ora, dovessi dire quali sono le domande che adesso sono più calde nella nostra area, sicuramente parto dalle testimonianze che abbiamo visto oggi. La prima, che si parlava di administrative burden e si menzionava sludge, sicuramente mi aspetto che sludge e le frizioni che possono condizionare le scelte che facciamo sarà un tema caldissimo nei prossimi mesi, anni. Elisabeth ha presentato questa ricerca su formality effect, secondo me è una cosa rilevantissima che un po' viene fuori da quello che ha presentato lei e se vuoi anche da quelle dopo, è l'importanza un po' del contesto e l'interazione tra le scelte individuali e quello che è il contesto, alcune variabili un po' più sistematiche, il fatto che in quel caso in particolare il governo viene associato con questa formalizzazione delle comunicazioni, è un'aspettativa che in certi contesti abbiamo, per cui la formalizzazione, per questo quando andiamo a vedere a livello individuale c'è un effetto che è diverso da quello che magari ci potremmo aspettare da altre fonti, insomma, da altri insomma, studi che sono stati fatti. Poi adesso una cosa che ha detto Marianna Baggio mi ha proprio colpito, prima già nella presentazione, il fatto che lei c'ha a che fare, di nuovo il contesto c'ha a che fare con appunto un territorio che coinvolge 350 milioni di persone, probabilmente ci sono delle specificità a livello nazionale, a livello locale, di cui a livello appunto negli studi nostri comportamentali dobbiamo tener conto, quindi questa è un'altra cosa che mi aspetto che giocherà un ruolo. Poi un'altra cosa che ha detto invece adesso sul fatto che c'è stato un momento in cui questi approcci sono andati di moda. E cosa succede se adesso la moda viene un po' meno? Secondo me questa è pure una domanda importante per noi ricercatori, perché effettivamente il Nobel, prima Simon, poi Kahneman, poi a Taylor, sicuramente hanno aiutato, soprattutto quella Taylor, hanno aiutato a rendere un po' più popolari questi approcci. E adesso secondo me si pone un po' la questione anche dovuta al fatto che le sfide che ci sono a livello globale sono di una scala che è proprio difficile da gestire, e uno si pone le questioni su quali sono gli approcci insomma più adatti per fronteggiarle queste sfide. Secondo me questa è una domanda che un po' ci coinvolge tutti e non so la risposta, onestamente. Diciamo che rispetto all'ultimo, la cosa che mi viene in mente, anche sentendo questi ultimi interventi, la cosa che mi viene in mente è che nell'ultimo periodo nudging sicuramente è stato proprio l'approccio dominante negli approcci comportamentali, all'interno degli approcci comportamentali, e adesso sentivamo Luciano Lippi. Prima dico, nudging, la cosa rilevante è allontaniamoci dagli incentivi monetari, la coercizione per favorire certi comportamenti. Diceva Luciano Lippi, lo stipendio, altre cose le diamo un po' per scontate e poi possiamo lavorare su altro. Forse uno slancio per gli approcci comportamentali potrebbe essere rivedere gli strumenti, diciamo, più tradizionali come gli incentivi monetari, quelli più coercitivi, magari cercando di capire come la compliance, qui torna administrative burden magari, può essere facilitata con qualche lezione che possiamo avere dagli approcci comportamentali. Quindi non magari stare fossilizzati su essere alternativi a quello che c'è stato, quello che comunque si dà per scontato più che essere superato, ma cercare di contribuire proprio a rendere quegli approcci appunto più tradizionali magari più efficaci. Forse questa è un'altra cosa che mi sentirei di dire.
Mi sento di appoggiare questo approccio e di integrarlo ancora con, secondo me, un altro elemento che è emerso è l'importanza delle evidenze, no? Anche nello studio di Elisabeth abbiamo visto come il buon senso anche dell'esperto spesso è molto fuori strada, no? Quindi abbiamo bisogno di evidenze, di testare le cose, di misurarle, di capire cosa funziona, no? Cosa non funziona e perché. E quindi questo credo fosse un altro degli elementi che poi anche Shelley ha ribadito con forza. E la sponda che ci fa la Commissione europea credo sia molto preziosa perché quello sarà anche un luogo nel quale far convergere le esperienze migliori, no? Di uso delle evidenze a supporto poi del buon management. Lascio una battuta conclusiva alla mia collega, la professoressa Vanieri, che ho visto a un certo punto comparire, anche per un saluto diciamo, alla comunità che ci sta seguendo sul nostro canale alla fine di questo anno di lavoro.
Io ringrazio tutte le persone che hanno partecipato, soprattutto insomma non è facile e scontato, no? Collegarsi da posti diversi, mondi diversi, paesi diversi, con tempi anche fasce orarie, no? Completamente diverse, per cui veramente la prima parola è un ringraziamento a chi si è collegato, e un ringraziamento soprattutto a Nicola e Paola che hanno organizzato questo momento che è diventato una routine per noi, no? Quindi avere un aggiornamento ogni anno su un tema di ricerca che per noi è fondamentale, nonostante diciamo poi quello che diceva proprio poco fa Paolo, no? E prima la Marianna Baggio della possibile, no? Potenziale magari considerazione di questo filone come un filone che va di moda. Per noi non è una moda, per noi è un asset fondamentale che serve a dare vita anche e alimentare anche gli altri filoni di ricerca che abbiamo in laboratorio, come quello della misurazione della performance, come faceva vedere benissimo anche, no, le ultime slide, la Shelley Metzenbaum, così come anche altri ambiti come quello dei PREMS, no? La Baggio ribadiva anche l'importanza anche del comportamento poi degli individui sul clima, no? L'atteggiamento che si potrebbe avere sia come individui ma anche come organizzazioni nei confronti, no? degli aspetti relativi al cambiamento climatico. Quindi io penso che indipendentemente ecco, come nota mi sento di essere abbastanza tranquilla su questo fatto che il fattore umano non può passare di moda, perché se passa di moda il fattore umano vuol dire che anche le altre ricerche perdono un po' e gli altri ambiti di ricerca perdono un po' di significato. Per cui ecco, ci tenevo davvero tanto a sottolineare l'importanza che ha per noi questo momento di confronto con chi in altri luoghi, in altri centri di ricerca sta conducendo delle analisi simili, perché su ambiti anche diversi o affini è un elemento per noi arricchente e importante proprio per alimentare, per confrontarci, ecco, con chi fa questa attività di ricerca in altre zone. Per cui vi ringrazio davvero tanto e tutto ciò che ho perso lo recupererò sicuramente ascoltando il video che è stato registrato, e sono sicura che utilizzeremo e che anche altri che non hanno avuto l'opportunità di collegarsi magari oggi pomeriggio ascolteranno questo video e queste vostre suggestioni con piacere, magari in un momento meno concitato, come diceva Luciano, l'ultima settimana, ecco, prima di Natale, per cui colgo le ultime parole per di nuovo ringraziarvi e augurarvi buone feste.
Allora, grazie a tutte e a tutti, a tutti coloro e a tutte coloro che sono collegate. Paola, un saluto anche da parte tua, perché ci siamo un po' coordinati, quindi...
Più che altro un ringraziamento a tutti voi e a tutti coloro che hanno partecipato e contribuito, e un appuntamento a questo punto al prossimo anno.
Buone feste.
Grazie,
Ciao, ciao.